All right, it's 12 o'clock, so I think it's time for us to start our event, 3D Bioprinting in Finland today. Welcome all. I hope we'll have an interesting afternoon. We will have 14 or 15 presentations by different experts in the field of 3D printing. We will start with some short poster speeches, and after that most presentations will be about 15 minutes. Every hour we have about a 5-minute break around 1 o'clock, and then 2 o'clock 5 minutes, and then 3 o'clock 15-minute break, and we will try to end the event around 4 o'clock in the afternoon. So this is a 4-hour session, and hope you will enjoy it. Please keep your microphones muted at all occasions if you're not asking a question or if you're the presenter yourself. Okay, without further delay, I think I will first start to show something about Tissue Cure Alliance Finland. I will run this presentation as a video, so I'll share it from another computer. Just a moment.
Hello, I'm Andreas, and I'm the coordinator for Tissue Cure Alliance Finland. Tissue Cure Alliance Finland is a non-profit community for tissue regeneration and wound care companies and research organizations. First, a few words about the background. Finland's high level of education, public sector research funding, and the growing field of tissue regeneration and wound care products created a need for an organization in this field. We identified a need for networking, cooperation, and information exchange, and we also wanted to create awareness among different interest groups. Tissue Cure Alliance Finland was founded in 2018 by Askel Healthcare, Sense, Finnish Red Cross Blood Service, UPM Biomedicals, and Åbo Academy University. We also have 3 associate members, CardioReg, Immunodiagnostic, and EpiHeart. So what does Tissue Cure Alliance Finland do? We offer a common brand and logo for our members. We offer access to specialized knowledge and expertise, networking and cooperation. We arrange seminars and get-togethers, like the one you're joining right now. We are sharing experiences and best practices, which we hope you will also do later on today. And we are also doing some marketing efforts on behalf of our members. So, what should you do if you would like to join Tissue Cure Alliance Finland? We have 2 forms of membership, full members or associate members. Full members can be either startups, universities and non-profit organizations, or growth companies. And since 2020, we also have an associate member as a form of membership. This is mainly for research groups and small organizations with less than 10 people. We hope that you're interested to join Tissue Cure Alliance Finland as a member. We welcome new members. For more information about Tissue Cure Alliance Finland, please visit our website, tissuecure.fi.
Okay, that was a short presentation about our organization, and we really welcome new members, so you can have a look at our website, and there's also a form that you can fill out if you're interested to join as a member. Okay, but that was the so-called commercial part of our meeting or our event. Now we have about 116 people here, which is great, so I think we will go on to the presentations. And our first presenter will be Nonappa from Tampere University. We are 1 minute in advance, but I think we can use that minute now. So please, Nonappa, the stage is yours.
Yes, great. Thank you, Andreas. I think you can hear me. Yes, great. I'll be discussing or giving a brief overview of what I've been doing over the past few years and currently after joining Tampere University. My area of expertise is mostly on 3D hydrogels, and one of the applications is for cancer tissue culture. Cells and tissues undergo a mechanical deformation continuously, either using the external forces or cell matrix interaction or cell-cell interactions. In response to this type of forces, if it is a cellular, cells will respond and react, and this reaction can be viscous, elastic, viscoelastic, passive, or active. Understanding these forces is really important if you would like to develop a new culture system or matrix. And therefore, it's also important to study how the mechanical behavior of these systems. And there are various ways. If you want to study a tensile force, then you will use tensile test or compression test. And these are static measurements. Whereas if you want to understand the shear and torsion, then you use a dynamic. These are the more dynamic measurements. And these have great relevance for preclinical and clinical applications. For example, having a well-defined culture matrix is important for patient tissue culture and expansion of the limited disease explants. They are also important to understand disease pathway, such as cancer metastasis. And I have been working on hydrogels and gels in general over 12 years, and initially on molecular gels. And over the last 8 years, I've been working mostly developing hydrogel-based matrices for synthetic and biopolymers. There are also matrices that are colloidal level. And one thing unique in this is that they all have a low solid content, and they have a highly entangled fibril network. And what we do is that we can tune the mechanical property, stiffness, porosity, and biochemical cues. The mechanical property can be generally have been working on rheology, and we really work on extremely low solid content materials. They are robust. And as an example here, I show a macroscopically a gel which is less than 1 weight solid content can be undergo very brutal mechanical deformation, such as you can see, it's almost liquid under strong vortexing. But it only takes less than 60 seconds to recover back. And these kind of materials are necessary if you really want to mimic the biological ECMs. And here we can see the microscopically from rheological measurement, where you apply a different strain, 0.1 to around 150%, then you can go from a gel to a solution, but it can recover within 60 seconds. What we do is that we correlate the macroscopic observation with the microscopic mechanical properties. And that is because of the well-defined nanofibrillar network, as it can be seen in cryo-electron microscopy, which is one of my expertise. And then we apply this one was necessary to study and culture patient-derived explants or tissues. And one of the application is because of our collaborators who have been working on patient-derived cancer explants for over 5 years using all commercially available matrices, and none of them have actually succeeded to retain the complexity, heterogeneity, and the ability to retain hormone receptor. When I say complexity and heterogeneity, if you take breast cancer, we can divide them into 3 major categories as luminal, HER2, and triple negative breast cancers. 70% of them are luminal. And if you look at these 2 categories, HER2 positive patient, 70% of do not respond to hormonal targeted therapy, and there is no targeted therapy because there is no hormone expression in TNBCs. And luminal, around 40% do not respond to treatment. In Finland, around 5,000 new cases of breast cancer every year. More than 30% are without any treatment. And the reason of all the failures is that if you take a patient-derived tissue and culture in commercial level matrix like Matrigel, what you end up is a transition from the original cell type to a totally a different cell type, both phenotypic and genotypic, which is confirmed using extensive genomic studies. And we have been working over 6 years together with Helsinki Cancer Research Group and Cancer Surgery Unit. And we have tested more than 1,000 patient tissues. And I have had one Business Finland funding where we have now ongoing clinical trial to implement the personalized treatment or informed patient treatment. And we have one more recently funded Business Finland funding for immunotherapy. And what happens, I can summarize, is that we have breast cancer surgery unit where we get the patient samples which undergo some of the pathological pathway, and then we fragment them and culture them, and we follow up the study. And in material science, where it's my role, we develop materials depending on the type of samples and the cancer type. We go one step further now. We also use this technique to identify and sort the type of cancer, whether this particular cancer patient will respond to immunotherapy or not. And in this way, we can give the complete information within 1 week. And finally, and the most important thing is not 90% of the deaths in cancer happen because of metastasis. Understanding this metastatic cancer pathway is also important. And another important thing is that detection and isolation of circulating tumor cells. There one may be in 1 in several millions or billion. So this is a key, and it's a major research area where we are looking at designing various technology such as microfluidics to understand both the cancer cell migration and invasion, and also to the extravasation through blood-brain barrier. And for this, the simple gel culture system doesn't work. We have to have device technology at the same time, where we use 3D printing to print the cells in this type of microfluidic devices. If you want to know more about our research, please contact me, and I thank you.
Thanks a lot, Nonappa, for this very interesting presentation. I think we have to move on because we have scheduled only 4 minutes for this, but it was really interesting to hear. So we go on to the next speaker, that is Ezgi from Åbo Academy University. Please, the stage is yours.
Well, hello everyone. I am Ezgi Özliseli from Pharmaceutical Sciences Laboratory from Åbo Academy, and today I will be talking about my research project. So we start with the background that the skeletal muscle consists of the 60% of our body, and it has high regeneration potential for tissue repair and homeostasis. However, surgical intervention is required in case of large volumetric muscle loss due to muscle dystrophy. So in the case of tissue repair, these myoblast cells, which are the committed muscle stem cells, differentiate and fuse into these myotubes that then they differentiate, then they form this mature myofibril bundle in our body. However, when there is the muscular dystrophy, autografting is not possible, and there is failure in this process. And we know that notch signaling plays crucial role in the tissue repair and homeostasis of these dynamics, and the inhibition of the notch signaling drives myogenesis. This process can be controlled, but it's highly complex, so it requires special and temporal control of the biochemical cues. So mesoporous silica nanoparticles are the promising tools as vectors of targeted and controlled release of drugs. They are highly suitable for this work, and they have unique properties such as biodegradability, and also their surface properties can be engineered to manipulate the cellular internalization and also control drug delivery. So notch signaling is dose dependent, and it can be inhibited by small hydrophobic drug molecules such as gamma secretase inhibitor, and notch inhibition requires targeted and controlled delivery to guide this differentiation process so that we do not influence the surrounding tissue when we form the new muscle fibers. So the methodology of the project basically relies on engineering the biofunctional scaffold with the right amount of nanoparticles that are surface engineered and that they will work as drug delivery system, and also the hydrogel composition that can be 3D bioprinted with the cells included inside, and then without further intervention, then the scaffold would allow cell attachment and proliferation, and then the nanoparticles would be internalized by the cells, and the drug release that would lead notch signaling inhibition that would result in myogenesis and then forming these myofiber bundles. So far in the project, our results show that the mechanical properties of the scaffold can be tuned by the composition of the hydrogel, and the mechanical properties of the environment has actually very big impact in the muscle differentiation. When we tested the soft and the stiffer scaffold, we could see that there is some little differentiation started on the day 14 already. And then when we take it further to investigate the nanoparticle drug delivery in 3D matrices, we have employed this carbocyanine dye that mimics the hydrophobic drug model. And then we could investigate it on the single cell level in the 3D matrices, the drug release within the cells. So the project is still ongoing. And the next step will be evaluating the notch inhibitory drug response on cells in 3D. And in general, this approach can be used for engineering muscle as transplants for the muscle dystrophies, as well as this can be also applied for building disease models for drug discoveries. So I would like to thank you for your attention, and also I would like to thank my supervisors, group members, and the collaborators and the master students, and also foundations for the financial support. Thank you.
We will go on to the next speaker, that is Marika Mannerström from Tampere University. Please, and remember to turn on your microphone before you speak.
Good afternoon, everybody. The title of my talk is A Model for Investigating Interactions Between Different Cell Cultures Separated from each other by a 3D printed hydrogel barrier. We call it a barrier model. The aim of the study was to develop a model where cells are co-cultured in the same well, but separated from each other by a hydrogel barrier. Cells do not cross the barrier, but medium hormones, growth factors, chemicals, and so on can cross the barrier. The model can be applied to experiments where to investigate the interaction between different cells without them being in direct physical contact with each other. How are the barrier rings constructed? We have 3D printed both Grodex and Growing T hydrogel rings using Cellink's Incredible and BioX printers. And Growing T rings can be successfully printed to 12, 24, 48, and 96 well plates. Grodex rings can be printed to 12 and 24 well plates. In smaller wells, there is no empty space inside the rings because the hydrogel tends to spread a little. Here's one application that we have been working on. It's an assay for metabolism-dependent toxicity. The role of liver is to protect the organism by detoxifying chemicals. However, sometimes liver metabolism increases the chemical toxicity by producing metabolites that are more toxic than the parent compound. Therefore, there is a need for a cytotoxicity assay, which tells whether the chemical itself is toxic or whether it is not toxic itself, but its metabolites are toxic. So hepatocytes were seeded on Grodex outside the Growing T ring, and fibroblasts were seeded inside the ring. Chemical is then dosed on the hepatocytes, and the viability of fibroblasts is measured up to 4 hours exposure. And a similar setup without hepatocytes outside serves as a control. The results show chemical toxicity to fibroblasts with or without hepatocyte metabolism. So this is a straightforward alternative to investigate metabolism-dependent toxicity of chemicals, as dosing and viability measurement can be performed on the same well with no need to collect and centrifuge and dose the hepatocyte conditioned medium separately to the target cells. The challenge is to find human hepatocytes with sufficient metabolic activity. And we have tried different sources of human cryopreserved hepatocytes, but the most promising hepatocyte model has so far been the human hepatic cell line HepaRG cells. And HepaRG cells, when they are seeded on Grodex next to the 3D printed growing T barrier, forms quite nice liver-like morphology. So this is the research group and my last slide. Thank you for attention.
Thank you, Marika. And this was the last of the short poster speeches. And as previously, you can also ask questions to Marika in the chat if you want to go on and have something you want cleared out, or in the Q&A session later in the afternoon. Okay, but our next speaker is Susanna Miettinen from Tampere University. Please, the stage is yours, and the microphone, of course, if you forgot.
Thank you for this opportunity. I will try to share my screen. Now, can you see my screen? I can try to put on the presenter's mode, but the notes are preventing me to do so. Now it's clear. So can you see now my presentation?
Yes,
and
well.
You can hear me too. Good. So thank you for this opportunity to give this presentation and talk about our networking plans. If the time allows, I will also shortly tell about our bioprinting activities, but let's start with the bioprinting network plans that we have.
Although we are all enthusiastic
about bioprinting and trust that this is very promising technique for all kinds of purposes that we are planning to use this, we are all aware that this technique has its challenges. First of all, the bioinks, they need to be biocompatible and multifunctional for many cell types that are going to be printed with bioprinting techniques. We are all developing our own bioinks for our purposes, so we know that there is still room for improvement in this field. Also, the bioprinting process might be a challenge. We need to have bioprinting process where we are able to print viable and functional cells with higher precision. Without high precision, it would be all the same to just cast the cells and mix it with biomaterial. That would give equal precision if we can't maintain high precision that we are trying to reach with bioprinting techniques. Cross-linking might also be a challenge. Structural integrity and stability should be reached without compromising cell viability and functionality. This is still today a challenge. We don't want to see this kind of collapsing towers anymore when we are printing our materials. What might be necessary after cell printing or bioprinting is to continue culturing those tissue structures in vitro so that they are mature enough to be transplanted. So a long-term cell culture for bioprinted constructs is also still a challenge. In this field, we might need some microfluidic devices, for example, or simulated physiological environment to support the viability and maturation of the constructs. Then, of course, clinical translation and regulation process is always a challenge. It is complicated enough for cells and materials alone, but then bioprinting and 3D printing brings one more level of complexity in this picture. So I think collaboration is needed in this front to solve this puzzle. And this is now why we are founding a bioprinting or medical 3D printing ecosystem in Finland. I'd like to extend this bioprinting into medical 3D print since I believe in this kind of gateway theory here in 3D bioprinting. Researchers and doctors perhaps start by using 3D printing for modeling the surgical operations that they are performing, but from that step they might continue into 3D printed plates and scaffolds and perhaps combine those scaffolds with culture expanded cells. And then in the end, they continue in this hardcore, so they might be able to test bioprinting for treating their patients. But of course, many steps needs to be taken before we reach this goal. So goals of our ecosystem that is still to be established is to bring together national and international research groups. I think this is important also here in Finland, since let's start from our own university. I don't know what groups in Tampere University are active in this field of bioprinting. No matter what the researchers are doing in Turku or in Helsinki. So I think that the network and collaboration and working together in this field is really needed. Also, I think that this is very promising field in this sense that we need to tighten the link between research groups and industry in bioprinting and 3D printing field. We need to share knowledge. As I mentioned already, I don't know what bioprinters or what 3D printers we have in Tampere University and what are available for our different purposes to use 3D bioprinting. So knowledge should be shared. Collaboration opportunities, of course, would be provided by this kind of ecosystem. This ecosystem could also function as a service platform, so that different research groups, for example, list what kind of techniques they could offer and what kind of services they could offer in this bioprinting field. Business opportunities could be available in this ecosystem or network. And of course, our ultimate goal is to find solutions for major challenges that limit the clinical translation of 3D printing techniques. And of course, the idea is to advance patient care and diagnostic in Finland. So now we have funding from Academy of Finland for 2 years to found this ecosystem. We have now started this as a co-creation project with a company found in Tampere called Idea Scout, and we are just at the beginning of this process. And the activities will be done through workshops where we are defining the needs and mode of action of this ecosystem. And of course, we don't want to stay only in Finland. I think that we need to make good connections, and also, of course, research groups already have good connections to other research groups around the world and in the Nordic region, but I think we need to then build also connections to existing networks in Nordic region and in Europe, for example. When we applied this project, we were contacting different companies if they would be interested in joining our network and if they feel that this kind of activities would be important. We have some bioprinter companies involved there in the project, or who told us they would be interested in joining. Cellink and Brinter, they are giving presentations today, so you will hear more about their activities today. Also UPM and a couple of other material companies were involved in this project, and you will hear more about UPM's activities later on in this seminar. So please contact me if you are interested in networking activities in this front, in bioprinting or 3D medical printing. I would be really interested in hearing your thoughts about these kind of activities and what you think are the most important aspects that we need to take into account when building this kind of network. I still have a couple of minutes time, so I will continue with our bioprinting activities that are ongoing in my research group. There's kind of two directions that support each other in my group. We are using bioprinting to build in vitro models, and then also perhaps to use 3D bioprinting and 3D printing to produce transplants for patients. In my group, we are mostly interested in bone transplants. My group has been active in this front so that we have been treating major bone defects in craniomaxillofacial area already since 2006 by using autologous adipose stem or stromal cells to treat these bone defects. And we have been combining these stem cells with beta-3-calcium phosphate or bioactive glass granules, and then we have used BMP2 as a growth factor in many of the cases. The shape and size for these transplants have been given by a titanium gauge that can be seen over here. And that is quite cumbersome method. We have been using this technique for 30 patients, and some of those results have been published already, and the treatments have been done in collaboration with Cell and Tissue Center and many hospitals in Finland, and also Sahlgrenska Academy in Sweden. But as I mentioned, there is room for improvement in this technique. And I have been showing this kind of image previously in this context, so that this is my dream to be able to use a kind of Play-Doh kind of material to make suitable transplants for these patients. And now I think that with 3D printing, we are slowly getting there, and we are moving closer to this kind of Play-Doh solution. So first of all, I'd like to proceed by utilizing 3D printing to produce the suitable scaffold for the patients, and then combine in vitro cultured cells to this 3D printed scaffold, and then use that to treat the large bone defects in the patients. But then, of course, it would be a dream to use also bioprinting and perhaps in vitro tissue maturation before transplantation to treat these large bone defects. So we are moving slowly towards these kind of solutions. We have now a 3D printing and bioprinting project together with Professor Kamal Mustafal from University of Bergen in Norway. And the goal of this project is to bioprint and 3D print vascularized bone. In this project, we are utilizing bone marrow-derived mesenchymal stem cells and endothelial cells, and we are developing bioinks that are supporting bone and vascular formation. Both laboratories here in Tampere and also in Bergen have the same bioprinter device to study the repeatability of the bioprinting process. We have both the EnvisionTex bioplotter for this purpose. The goal here is to heal actually long bone defects. Over here you can see the mandible that we have printed with this technique. But in this project funded by Olaf Thun Foundation, we have the goal to treat long bone defects of these patients. And we have planned to have a clinical trial so that we could use 3D printed scaffold together with cells in this project. But let's see whether we can reach that far over here. I can't kind of avoid mentioning also bioprinting transplant activities in this corneal field. Professor Heli Scottman's group is very active in this front, and my group is collaborating with her so that we are providing mesenchymal stem cells for Heli's group's activities. And they have very sophisticated and nice solutions for printing. First of all, developing bioinks for corneal solutions, and then also how the stem cells should be cultured and combined with the bioinks for this particular area. So if you are interested in corneal bioprinting, please contact Heli Scottman or Anni Mörö. Anni Mörö is perhaps the most experienced researcher in this bioprinting field in our university, so you should contact her if you are interested in this. We are also planning to use bioprinting in our Center of Excellence in body-on-a-chip research for certain fields of applications to kind of in vitro models. My group is interested in vascularization, bone and bone marrow in vitro models, and also adipose tissue models. But our research groups are also using bioprinting for innervation studies, heart and liver applications, and of course, Minna Kellomäki's group is also developing biomaterials in this context. And Pasi's and Jari's groups are also involved in that sense that imaging techniques and microfluidics, for example, could be utilized with these bioprinted techniques and scaffolds as well. We have 2 bioprinters that we are utilizing in my group. We have EnvisionTech's BioPlotter, and then we have Cellink's BioX, and I really have to give credit to this Cellink BioX. Although this BioPlotter is really fine bioprinter, but our students are using this Cellink BioX in their coursework, and they learn it very quickly, and it is easy to use in that sense. Here are my group members. Our bioprinting team is shown over here. So if you are interested in networking activities or our group's activities in this bioprinting field, just please let me know. And thank you for your attention.
Thank you, Susanna. As a part of a network, it's very interesting to hear that we are forming new networks here and trying to learn from each other. And it's a very important initiative, I think, and I think we can continue the cooperation in many ways in this field.
Let's see what will be the kind of mode of action of this network, but I think it is really important to have kind of network in this field.
Absolutely. Okay, we can continue the discussion in the chat if you have direct questions to Susanna, but let's go on, and we will give the word now to Antti Arjonen from Brinter.
Yes, good afternoon, everyone. My name is Antti Arjonen, and I will give you a short presentation about printer applications, what we have recently done, and about the technology around the printer. So my personal introduction. So I have my background in cancer research, cell motility, especially in adhesion biology, so integrins, and related around microscopy. I have also worked for a while with personalized medicine, meaning with the cells related and from cancer cells and how to diagnose these cells. And now to date, I have been working with printer towards the 3D technology to bring these aspects together. So cancer research, 3D printing, and microscopy. So short introduction to printer, and I would like at this point to remind that we have also a second presentation today by Pasi about the printer as a company, and I will now focus more to the application side. So the most important aspect of the printer is that it's modular bioprinter. So you can have several different kind of tools, and the technology is not limited kind of per one purchase. So later on, if you want to update your 3D printer, you can simply purchase new novel tools, and they will be completely functional with the printer, 3D printer. And it's also possible to upgrade from desktop to mass production. And there is a camera process view for quality control. And as I said, several different kind of tool heads, cooled and heated print beds are available. Recently, we have been very focusing on the photo curing LEDs, so several wavelengths and several methods for photocurable bioinks can be used together with the printer. Also, we are very proud of our own slicing software, and the coding of these softwares is done in-house, and these can be tailor-made to meet the purpose of your research idea or company idea or whatever you have. So our main focus is always the customer. So the interface of printer is based on a browser. It's very fast to learn. There's no software downloads needed. And simply all you need is internet connection and your own computer that is in the same network with the printer. And we provide several updates that can help your research. A couple of simple images shown here related to the user interface. Short look into the different kind of tool heads we have. So we have heated and cooled pneumatic tool heads with several different wavelengths of UV LEDs available. We have also visco tool that is meant for more paste-like or higher viscosity materials, and that is endless piston driven. So not the printing of the material is not driven by pneumatic pressure. So with this tool head, you can print more high viscose materials. Then we also have micro droplet tool that is mainly for handling different kind of liquids, and also triaxial tool. And there you can print, for example, 3 different materials together inside of each other. And this is also available with LEDs. Then you can combine all of these together with granulate tool that can be used to print plastics. So I would like to emphasize that all of these tool heads can be used together depending on the model that you are printing. So you are not only limited to bioinks, you can combine bioinks together with plastics and also add some liquids with the liquid handling tool. We also have heated and cooled printing beds. So the range of control there is always from 2 degrees Celsius all the way up to 80 degrees Celsius. And additional LED module. So if one does not need the tool heads together with the LED module, so the printer comes with a separate LED module that can be freely combined and freely designed curing strategy that can be used. Example of consumables that can be used with the printer. These are readily available, can be sterilized, can be used with sterile cell culture, and different size of nozzles are available. UV shielded or simply plastics that you can print with any kind of bioinks. Bioinks that we have tested so far are very versatile. So basically I have not come across so far a material that could not have been printed with a printer. So here is just a list to mention some of the materials that we have successfully tested, all the way from alginate to gelatins, collagens, matrigels, nanocellulose materials, and here I mean both fiber nanocellulose materials, for example, from UPM, or crystalline nanocellulose materials. both of them successfully printed. Also different kind of polymers or bone-related materials and granulate materials, for example, PLA or wood cellulose enriched granulates all work nicely and can be combined. We have also our own material development in the process, and one of the most prominent that I think and close to my heart related to adhesion biology is this printer boning. This is related to including true bone particles in the boning, and the goals of this material is to give researchers and the companies true bone material that would have transparency, so it could be used together with microscopy, and better printability, and also osteoblast and osteoclast differentiation and calcium formation. Some pictures shown about the development process in the lower part of the screen. I would like to share with you showcase projects with different universities done with the printer. The first one, ductal carcinoma in situ, is related to breast cancer and mechanosensitivity between the breast cancer cells and the surrounding tissue. Then the other one is chondral repairment related to EU Restore project done together with Oulu University. And then one project, very recent one, done with University of Glasgow related to bio circuits. So related to this breast cancer project, ductal carcinoma in situ, the relevant question was that why are all the cancers mostly developing in the thermal duct part, so the purple part of the breast cancer or the breast tissue structure, and not in the lobules. So the simple model, some pictures shown here. So the upper left-hand corner is a mouse mammary gland, and in the center you can see a true patient human mammary gland. And the idea of this project is to replicate the same model, 3D printed, and to study what are the matrix forces and how strongly does the cancer cells pull the collagen fibers towards the tissue. Some example pictures, CAD model designed and printed structures, and this can be done in well plate mode, and this is actual picture done with the printer. So I would like to point out here that the model creation is successful, and also we can print clearly viable cells which are making spheroids. And if you look at the edges of the structure, one can see that you can see clearly invading cells leaving from the structure and exerting forces to the surrounding matrix. The another model is related to chondral repairment. So we have a clear application how to make from a stack of computer tomography images to a printable STL file. And the addition of the file to the printer slicer software is very straightforward. One simply inputs a file and inserts the different parameters that would be good for the 3D printing purposes. Changing these and testing these is very straightforward. And example image of the 3D printed structure in its true size in a supporting gel. Application notes are available upon request, sending email to me. And when the supporting gel is diluted away, one can have the 3D printed structure made without the supports. So very nice example of what can be do at the moment with this protocol. The last example is about these biocircuits. I would like to share this one with you because it shows you nicely that if you have a complex model of two different STL files that would need more like layer by layer kind of printing compared to object by object kind of printing. So it's a doable. And the main point here is to emphasize the fact that printer can change the different tools on the fly when the structure is being printed. So you can combine all the different kind of tool heads and make the model, and only the imagination of one's research project is kind of the limit here. So thank you. I would like to thank you, and hopefully the interruption wasn't a disturbance for you guys. All the protocols application notes are available, so send me an email. Thank you.
Thank you, Antti.
So hello everyone, and thank you for having me. It's been super exciting to hear all of the research that we've been doing here in Finland currently, and I'm so excited for the afternoon as well. My name is Isabella, and I am application specialist here at Cellink. And what we do at Cellink, together with our customers and collaborators, is to create the future of medicine, because we believe that the future of medicine cannot happen without 3D bioprinting, 3D cell culture platforms. And to begin with, I would just like to bring up some of the challenges we're currently facing in medicine. And it is in our vision to shorten drug development cycles, find platforms where the organ shortages can be overcome, and help to invent more relevant testing methods. What can we do? I would like to share some example of what has been done already within the Cellink community to get it closer to our common goal of a more ethic, efficient, and advanced 3D cell culture platforms. We are extremely grateful to have and proud to have a lot of customers who are pushing the frontier of science. One of them is Professor Shekhan at Newcastle University, who has used bioprinting to demonstrate that 3D bioprinting can be a feasible method to create artificial corneal structures and used for in the future for corneal transplantations. And in the future, I would love to update this slide with the work from Kelly and Annie on the cornea. Right. The next example is from the Rensselaer lab, where the researchers developed vascularized and perfusible skin tissue models made up of human endothelial cells, dermal cells, parasites, and vascular cells, and collagen. And I used the Cellink BioX with the temperature control options of the print bed and also the print bed to ensure that these concepts could be printed. And the balance between the cells and the cellular arrangement enable the cells to start communicating and, more importantly, form a biologically relevant vascular structure within a few weeks. And here we can see some images of the research, where we can see that the bioprinted skin tissue model resembles the native skin in terms of where the markers are positioned. My last example from customers for today is from Birmingham Women's Hospital in Boston, where the researchers used an Incredible Plus to develop first in vitro model to study calcific aortic wall disease. And the bioprinting allowed the researchers to accurately study how the environment, and more correctly, the stiffness in the environment led to the spread of calcification, and how this spread differed in the biomechanically distinct layers, creating a model that successfully stimulated an artificial leaflet. So let's dive in to see what different bioprinting methods that we currently have available today. The two basic bioprinting methods that Cellink has commercialized are extrusion-based bioprinting and light-based bioprinting. And in the extrusion-based bioprinting, you are depositing your bioink or material in thin lines or filaments on top of each other to create a structure from the bottom up. The extrusion-based bioprinting can also be used to create small droplets of materials. For researchers who would like to culture the cell 3D, but don't actually need a complex geometry to study the cell to make its interaction. The light-based bioprinting is based on the principles of optics, and it uses patterns of focused low wavelength light to harden photosensitive materials. And this curing process takes place layer by layer or point by point to create the structure. So if you're on the extrusion-based bioprinting or depositing material on top of each other, you with the light-based material more or less have a build platform that you drag up your constructs from the photo ink layer by layer. And both bioprinting methods can be used to create complex 3D structures, but the based bioprinting has been more extensively used for creating complex lattice and vascular networks due to the high resolution of light, while extrusion-based methods has a greater capacity to handle different types of material and cell types simultaneously. And these platforms are perfect to combine, where you could, for example, create a specific cell laden or a cellular chip with the light-based printer that has an inbuilt vasculature network. And then you can fill this chip with extrusion-based bioprinters with different types of cell cultures in different types of hydrogels. And we are also proud to have a strong foundation in biomaterials, and we are really committed to providing researchers with the highest quality of materials for their research needs, whether it is materials for bioink development like stop silicons or concentrated components, or ready-to-go bioprints that are developed by us or any of our collaborators to be specified towards a specific tissue or cell type. And as you might notice, we currently released our collaboration with UPM to get better non-animal derived non-cellulose biomaterials as well. So it's super exciting. Good. So all we look for here at Cellink is really to go and the benefits of 3D cell culture. And I will show some examples of how we have utilized and compared 2D compared to 3D cell cultures in-house. And a simple yet powerful work that we have enabled here within Cellink by our scientists is to start from some sort of cells. These are then embedded into the bioink and bioprinted with the bioprinter, and then cultured in 3D and analyzed. And this can be applied to almost any tissue and cell type. So what we see here is a co-culture of uric and fibroblasts to the right, cultured in gamma fibronectin. And we can see that the cell-to-cell and cell-to-matrix interaction enables the UX in this co-culture to spread and form this complex 3D network in 3D. While in 2D, in the control, the UX formed a flat network that cannot stretch in the 3 dimensions, demonstrating the importance of and the feasibility to use the 3D cultures to support to make these complex vasculature models. The next study, we focused on the stem cells instead and iPSCs. And when we cultured them in 3D, in Jalma laminin 521, we could see that all the pluripotency markers were retained within the iPSC, and that the iPSC formed this like structure that is phenotypical for iPSC. And in this setup, we did not see this happening for the 2D culture. And the fact that the iPSC retains all the pluripotency markers after being bioprinters creates the opportunity to make more advanced experiments involving the differentiation of stem cells after the bioprinting session, as well as future patient-specific regenerative medicine studies. In the last example, I want to bring up one with bioprinted G2 liver cells and stained it for alpha-smooth actin. And in the 3D culture, we could see that the heavy 2 cells arranged to form a more native-looking phenotype, and that the actin was relocated and mostly secreted at the borders, where they also formed a barrier structure and not as much in the center. And this rearrangement that we did not see happening in 2D opens up the possibility to evaluate and localize subcellular compartments to really target the research to specific organ parts. And as my final example, I would like to show when we in-house tackled the challenge to quantify the impact of 3D cell culture with the help of bioprinting and what the effect can have on the drug development workflow. So the workflow was similar to one I showed previously, that we have harvested to 4 different types of cancer cell lines. We embedded them in Jalma or collagen, and then we used the BioX to bioprint mini tumors that were then cultured in 3D and dosed with our non-contact dispenser, and screened for the effects on the viability. And the results we got was to recognize a false positive as well as a false negative in the workflow. And a false positive in this sense is a drug that kills cells in 2D but failed to kill with the same efficiency in 3D, as we could see here for the cisplatin drug. While on a false negative is a drug that fails to kill in 2D, but show efficiency when the cells are brought up to 3D environments, as we can see happening for Gefnib. And not only could we see that Gefnib was more efficient in the 3D cells, we could also see a dose effect depending on how much drug we added. And we could see already in the lower dosages an effect on the viability. And in a workflow where the researchers only would have used 2D cell protein models, Gefnib would have been missed out as a cancer-killing drug. If you would like to read the full stories, head over to our webpage where we have our application notes. We also have data from our collaborators, a publication library with over 700 publications within the bioprinting area. And we also have protocols of how to work with 3D bioprinted models, both in terms of analysis as well as or analysis of whole 3D structures, as well as digestion solutions if you would like to digest your bioprinted construct to take out the cells for analysis. So this short on who are we actually at Cellink and what is our story. So Cellink was created here in Gothenburg, we're located back in 2016. with the world's first Biolink made out of nanocellulose and alginate as a base. However, 2016, there were not that many available 3D bioprinters, and the ones that existed were very, very expensive. So then the company went on to develop easy to use bioprinters that are for everyone, whether you're a company or a research institute. And today we have over 80 patent pending patented and patent pending inventions over 5 companies. And I think this needs to be updated, since we recently also welcomed Genolis for robotics and diagnostics and Matic for advanced in vitro tissue models into the family. We have 10 offices globally with a headquarters and production site here in Gothenburg, and we are present in over 60 countries, and our bioprinters and products are present in over 1,800 laboratories. And our motivation here at Cellink is to keep working with our wonderful collaborators to enable them to do the cutting edge research they are doing, and to always provide them with the tools they need to perform it. And with this short talk, I hope that you're all thinking of how bioprinting can be applied to your research, and you're more than welcome to contact me or anyone at Cellink for more information. I would also like to mention our local distributor from Immunodiagnostic, Katarina and Janne, and you're more than welcome to reach out to them as well. They are really, really nice to work with. And last point, we recently launched an education package. So if you're interested in getting your student or a curriculum up and going for 3D bioprinting, reach out to us and we let you know more of this. And yes, I will have a demo later on as well. So please hang in there where we will show the system in action.
Thank you, Isabella.
My name is Xiaojun Wang, and I'm currently a research fellow funded by Academy of Finland at Academy University. My hosting group pharmaceutical science of laboratory and laboratory of natural material technology. Today, I will take this opportunity to present to you some developments of nanocellulose-based biomaterial ink for light assistance 3D printing in our research group. For hydrogel extrusion 3D printing, I would like to open up with a question to you: how to ensure good filament resolution and shape fidelity. What we know is appropriate rheology property of the ink, as well as the in situ cross-linking step, which synchronized to the extrusion step, is the core to those answers. Intrinsically, light-based 3D printing technique is prevailing nowadays in the development landscape of 3D bioprinting developments. That's because light-induced photo cross-linking is have the commonness to allow the spatio-temporal control when fabricate heterogeneous properties within the hydrogel constructs. When formulated this photo cross-linkable biomaterial inks, there's a wide array of mesocrylated polymer to choose. Gelatin MA and mesocrylated hyaluronic acid are well established in wide use. And mesocrylated silk fibrin is a hot topic in the research field. Even recently, you could see the reports on mesocrylated decellularized extracellular matrix. In the catalog of natural polysaccharides, I would like to especially mention mesocrylated U1 from marine algae, as well as methacrylate galactoglucomannan from extracted from softwood, as new development into this expanding family of methacrylate biopolymers. Those polymers are preferably to be used in combination, actually, in 3D bioprinting, because they were needed to provide both compatibility as well as the as demanded material property when fabricated specific models. Some additive component such as collagen or arginate, even nanocellulose, is also included in the ink formulation, either to modulate the rheological property or to modulate the material property, such as hydrogel stiffness, etc. Nanocellulose-based biomaterial stands out for its outstanding property of nanocells itself. My next slide. What I present to you is one of the ink formulation we created in our research. We call it high performance all wood biomimetic ink. Why for that? Because we utilize the methacrylate GGM as the photopolymer. If you don't know, the GGM is a polysaccharide concentrate in softwood, which has an intrinsic affinity to the cellulose surface via hydrogen bonding. From biomimetic point of view, it can functionalize as an anchoring polymer in engineering the nanocellulose surface. Back 2 years ago, we synthesized the GGMMA in-house and formulated together with 1% of CNF, temper oxidized CNF hydrogels to get a UV cross-linkable formulation. The formulation utilized 1 to 3% of GGMMA. So as you can see from the photorheology, the dilation took place actually very rapidly by adjusting the concentration of GGMMA in the ink, or alternatively by engaging different GGMMA of different substitution degree of methacrylation. We're able to tune the stiffness of hydrogel in a pretty wide range. These inks has very good printability when print objects of large dimensions. At the same time, the cytocompatibility of this ink system has been preliminary validated utilizing a post-seeding culture of human dermal fibroblasts. In another study we make, we have seen temper oxidized CNF actually can promote cross-linking of extremely low concentration of gelatin MA, less than 1%. We were able to print soft but well intacted hydrogel constructs using this formulation, less than 2% of dry matter in the ink system. And if you do the 3D bioprinting work, you will know if you only utilize gelatin MA as the ink formulation, a minimum 8 or to 10% is necessary to provide acceptable ink fidelity. Here, the electrostatic interaction between the temper oxidized CNF and gelatin MA unexpectedly induced the dilation upon UV exposure and consequently provided the ink fidelity. And during our research, we soon have come to this point that the nano dimension, as well as the surface charge on the cellulose nanofibers, dictate the printability of these nanocellulose-based ink systems. More importantly, the surface charge on the temper oxidized CNF would cause complex scenarios when we seek the application of this system in cell-laden bioprinting. As the reason is, as this negative surface charge accounts for the colloidal stability of nanofibrils in the hydrogel, meanwhile, it makes it the system sensitive to the ion strength when we're mixing in the physiological buffer. So in order for us to know better our system, with collaborating with UPM Biomedicals as a contract R&D project, we have the opportunity to compare their grow ink system, which is CNF based hydrogel systems, with our ink systems. As you can see here, we worked with both growing N and growing T formulation. Growing N has very limited amount of surface charge, and growing T has negative charge of carboxylic acid group. I would say growing T have an intermediate level of negative surface charge compared to the previous temper oxide CNF we worked in our own systems. And here we have utilized 2% of GDMMA or 5% of GLTMA in the formulation, and then varied the concentration of CNF hydrogel in the formulation. The reason we engaged this formulation is try to compare because we know the substitution degree of methacrylation in GDMMA and in GLTMA. Actually, the cross-linking density of methacrylase in these two components at 2% of GDMMA as well as 5% of GLTMA is equivalent. So systematically, we utilize a rheological tool to understand the intermolecular interaction among these biopolymers, as well to evaluate the shear flow recovery behavior of this biomaterial ink. I have some, okay, yes, now. For example, when we look at the viscoelastic property of these bio inks to understand the solid component of these inks, as well as the shear stress at flow point, we could see 2% of GDMMA addition into both growing N system and growing T system actually decreased the storage modulus and the shear stress at flow point to different content. And it decreased larger content in neutralized growing N formulation. However, when we add in 5% of gelatin MA into the system, for growing N, gelatin MA addition decreased the storage modulus and the shear stress at flow point. But the 5% of gelatin MA addition in the negatively charged growing T system largely increased these parameters. And when this is translated into printing scenarios, what it means is GDMMA containing ink would allow we use a smaller shear stress in order to extrude the hydrogel pass through the nozzle. However, the addition of 5% of gelatin MA into growing T system would require larger shear stress in order to extrude the material through the nozzle size. By looking at the photorheology, we also reviewed the cross-linking kinetics of these ink systems. As we could see, the gelatin MA system is slower in terms of cross-linking kinetics compared to the GGMMA containing systems. By analyzing the Young's modulus of these hydrogels, we also obtained the results. GGMMA systems gives much stiffer hydrogels, whereas the gelatin MA containing inks are softer, but at the same time they are more elastic. They showed extended strain at break. In this study, we also performed a quantitative assessment on the ink printability in order to optimize the printing parameter. With adjusting the input flow and the printing speed, we characterized the filament width as well as the uniformity of the filament. With these parameters set up, we continued to play with the layer height and quantitatively analyze the PR and the DR value. And PR value is a value to characterize the filament fusion between the stacking layers. The results showed the gels are undergelated, as the PR value is always under 1 for all this series of the samples. The DR values indicate the shape fidelity of the printed cross-hatched grades of the filament. The lower the better the printability indicates. Let's move to some video which I show you how the system works in the real life. And this is the printing process, ongoing printing formulation of 1% of growing and together with 5% of gelatin MA system. Here are some nice images we are able to create with these ink systems and how they have been performed when they stored in the PBS buffer. And no very obvious swollen behaviors was observed. Yes. This is another slide. I want to just generally show this research fellow project, and this is going to take place at our Academy for the next 5 years. The goal of this is to develop nanocell-based inks towards more diverse material functionalities and therapeutic delivery of bioactive cures. And our collaborative partners, including Tampere University Added Stem Cell Research Group, as well as the Intelligent Polymer Research Institution at the University of Wollongong, Australia. And another slide, which I showed here, is about the Akademi Functional Printing Center, which are joint efforts across the at Akademi, which cross the research unit within the profiling area of our molecular process and material technology, as well as drug development diagnostic profiling areas. If you are interested, please check it out from the website. And in the end, I wish to thank all my colleagues who has performed the work which I presented today, and all the collaborators we have, especially acknowledge to UPM Biomedicals for funding this industrial project, as well as to the Academy of Finland for the grants to involve us to do the research. Thank you.
Thank you, Saurju. And we'll go on quickly with the next speaker. We have Rubina from Aalto University.
Hello, everyone. I'm Rubina from Aalto University, and I'm happy to give this presentation today. And it's a good opportunity for me to be here. Thank you very much. I have been working with 3D printing techniques since I was a master's student in 2015, and now I'm the last year of my doctoral studies, and have been mostly working with 3D printing direct ink writing method, where we have developed scaffolds that are comprised of monocomponent hydrogels than more complex kind of multifunctional composites. I'm coming from the wood department in Aalto University, so most of the resources that we use in our studies is coming from wood. So I have been studying mostly nanocellulose and then lignin, also some works with hemicelluloses, but also some other sources of bio-based hydrogels, such as aloe vera gels. So this has been, this will be kind of our story mostly from the material side. Traditionally, hydrogels has been processed, for example, in the form of one-dimensional filament, or they were simply casted to obtain films or 3D structures. But with 3D printing techniques, we can actually produce customized structures where we can control different properties such as porosity, and also quite a lot we can play with the mechanical strength of the structure. But there are so many challenges, so that, as it was earlier mentioned by other presenters, that we cannot print everything. So there are some rheological behavior that the material should have in order to be nicely 3D printed with high fidelity. So rheology is the key. But the challenge that I have been facing a lot during my research is shrinkage. Most of the hydrogels that I use, they have the solid content of less than 5%. So there is 95% of the structure that is water. So when rehydrating, kind of dehydrating the structure, then we have like the challenge that the structure collapses. And sometimes you can have so drastic change that the final structure that you obtain finally is nothing like the one that you printed in the beginning. And when porosity is lost due to the shrinkage, this is usually not so much favored, especially for biomedical applications. But there are solutions to this. For example, methods like freeze drying or supercritical drying. These are methods that can decrease the shrinkage even to less than 5%, and kind of retain the properties that you initially started with. During this presentation, I'm gonna give you some examples of the different structures that I have been printing. Sometimes the focus has been just to print monocomponent system, for example, just nanocellulose without any additive, and playing with the nanocellulose itself with the surface charge and also with the rheological properties. But when we need to add additional properties that we cannot get initially from one compound, then we can have dual components or even more complex systems that are multi-components, like emulgels and emulsions and biocomposites. So I will quickly go through these examples. I started my doctoral studies with just studying cellulose fibers and the nanocellulose that we could get from kind of unmodified cellulose fibers. They were just bleached, and comparing them with the tempo-oxidized nanocellulose and also the acetylated nanocellulose. The abundance of hydroxyl groups in the surface of cellulose makes it very easy to modify it chemically to kind of introduce different functional groups in the backbone. For example, in tempo-oxidized nanocellulose, we have more carboxyl groups that makes the hydrogel more hydrophilic and, as you can see, transparent. Or by introduction of acetyl group, we can make the nanocellulose less hydrophilic. And acetylated nanocellulose for me is a special hydrogel because it becomes very viscous, even in low solid content, maybe less than 1%. So in one studies, I was trying to figure out in which concentration would native nanocellulose, tempo-oxidized nanocellulose, and acetylated nanocellulose show a kind of similar viscosity profile. And then when I found those concentrations, as you can see in the top picture in white, you can notice that acetylated CNF has considerably less solid content compared to the native CNF, and also the way they retain the structure after the print is different. So the more charged samples like tempo-oxidized and acetylated. Also, when checking them under the microscope, we can see that the shear that has happened during the printing create different surface roughness in different samples. And this would also be important, for example, for cell interactions. Our collaborator in Helsinki University studied the cell viability and proliferation of cardiomyoblast cells. And we were happy with how these very simple monolithic systems that were just printed and freeze-dried work as kind of a scaffold for these cells. Moving to the dual components, as I mentioned earlier, we would like to get properties beyond porosity and actually like a mechanical strength. For example, in one very recent work, we were using aloe vera gels that is very known for kind of being used for wound healing application because it's rich with chemicals that have antiseptic properties and they help for anti-inflammation and antifungal and antibacterial properties. However, aloe vera by itself, it is not mechanically stable, meaning that the rheological properties are not sufficient to be wet stable after print. So by adding nanocellulose, we actually make the skeleton more strong and we improve the mechanical strength, which will help to have a more wet stable structure. And these structures are also highly porous and we get kind of pores in different range of sizes, which show that we can load this with drug later and develop wound patches. The next example is going beyond kind of simple system and actually have a multi-component or kind of biocomposites. For example, cardiac patches. As you know, cardiac patches are pretty complex in a sense that heart is a dynamic tissue that is continuously beating. So for a patch to remain on the tissue, it needs to be electrically conductive and also so it should have some sort of elasticity and of course biocompatible. So we were kind of making composites, knowing why we are adding each of the material. For example, we use nanocellulose for the sense that it creates biocompatibility. It's biocompatible and also it creates a porous structure. And also we were using polyglycerol sebacate for the elasticity and flexibility that it gives to the composite, and also polypyrrole for conductivity. And then we could make nice compositions that they were viable with cells. And also they could have the level of elasticity, that conductivity that is required for a cardiac patch. And why PGS was a suitable choice? It is because we can control the mechanical properties of PGS by how much we let it to synthesize. And for example, by changing this time, we could finally develop a cardiac patch that it had the mechanical properties close to the human myocardium. And as you can see in the bottom in the same images, for example, nanocellulose is highly porous, but then if we have no nanocellulose, just the elastic and conductive polymer, we get a very dense structure that wouldn't have sufficient cell interaction. And by adding the nanocellulose, we get finally, if you see in the after photo, a highly porous structure that gives us all the properties that we need. And in the last example, I want to show some multi-component system where they are pretty complex in a sense that so many compounds are involved, emulsions and emulgels. But the beauty of 3D printing is that we can get a spontaneous core and shell structure if we have hydrophobic and hydrophilic mixed together, like compounds mixed together. So by choice of which needle to use, the polypropylene needle or the stainless steel needle during the print, we can bring the hydrophobic or the hydrophilic compound to the surface. And as you can see in the same images, we can basically make this core and shell structure. Of course, in wet spinning, we can also have this core and shell system, but this is going to be a 3D printed structure that has this core and shell in the grid lattice. And this is very suitable for controlled drug release because this kind of shell thickness is also possible to change during the print. And this is caused because of the shear that is induced during the printing. I would like to summarize my talk by saying that biomaterials, they have highly potential in this field because they have high similarity to extracellular matrix, and also they are valuable as a monolithic compound, and we can even make nice composites out of them. And we can get different porosities based on which polymer or which material we add to the system. And also these developed structures are applicable as wound patches, as meshes, and as implants. I would like to acknowledge our collaborators and also the research group that I'm coming from, Professor Orlando Rojas, and thank you very much.
Thank you, Rubina, for this very interesting presentation. And we'll go on here with the next presenter. It's Robert Luxenhofer. Please, the stage is yours, and turn on your microphone as usual.
Yes, you can see the presentation, I guess. You can hear me. So yes, thank you very much for giving me the opportunity to present here some of our work. I'm really excited to be here today. I've seen really great work, and yeah, now I will be presenting a little bit of what we have been doing. I'm basically leading the soft matter chemistry lab in the polymers and colloids lab in the Department of Chemistry at Helsinki University, and I relatively recently moved to Finland and to Helsinki, and in fact everything I show here today was from my previous work in Würzburg University, but we are basically starting now also to print and to do chemistry in Kumpula. All right, so sometimes I don't have the time in the end to actually go to this slide. That's why I bring in the beginning. So most of this work I present today was done by this guy, Thomas Larsson, and Lukas Hahn, but also Chen Hu. These are the three guys in Würzburg, or were the three guys that did most of the work in terms of the synthesis and printing, but we had a lot of help from others also. So I'm probably here a little bit exotic in a way that we are actually working with synthetic polymers and not biopolymers, which I believe most presenters so far have been working with. And what we're actually also working with is thermogelling polymers. So they basically change their rheological profile very, very strongly with the temperature, similar to gelatin, but a little bit different too. We've seen some talks speaking about pluronics, but more as a support material, and our materials are in a way relatively similar to pluronics, but also quite different. So thermogelling polymer, basically, just very briefly, you would have a certain temperature and concentration range where this is a liquid, and then typically when you increase the temperature, you will become this will become a gel, and maybe if we increase the temperature even higher, this will become solid liquid again. And such thermogelling polymers are typically block copolymers. In this case here are shown just very schematically tri-block copolymers of polyethylene glycol, and for instance the biodegradable polymer PLGA, or it could be also PCl, as taken from some of these publications. Now, how it looks typically is that you have in most cases, you have a clear liquid at cold temperature, then it becomes a turbid gel or slightly turbid gel at higher temperature. And at even higher temperature, you may observe something called syneresis. The most commonly known thermogelling polymer, as I mentioned before, is pluronic F127, or also known as Poloxamer 407. And this is a tri-block copolymer, polyethylene glycol, polypropylene glycol, polyethylene glycol. Now, I'm a synthetic polymer chemist, and we are actually working with this polymer platform. It's called polyoxazolines, or short POX, or polyoxazines. And what you can see here is that in every repeat unit, you have this tertiary amide motif, which is a relatively unusual motif for a synthetic polymer. And this confers a very high polarity, high interaction, strong interaction with water molecules, so very strong hydration. And depending on the side chain here, you can now make these polymers very hydrophilic, moderately hydrophilic, or thermoresponsive, or you can make them very hydrophobic. And this is basically the platform we've been working on for a number of years. And we also start to work now in Helsinki. And we use this for actually mainly for drug delivery. But by coincidence, we stumbled upon a few polymers which also do gels and are really nicely printable. So actually, I never planned to go into 3D bioprinting until a few years ago when we stumbled upon these gels. And the first member I want to show is basically something we came across when we tried to mimic Pluronic. So Pluronic, as I mentioned, is well known as a support gel. It prints very nicely, but it doesn't really, it's not cytocompatible enough, generally speaking, that it's used as a bio ink broadly. And the polymer that we first found by coincidence was this diblock copolymer of methyloxazoline, which is the hydrophilic block, and propyloxazine, which is the thermoresponsive block. And it shows very interesting behavior. When we just do the rheology, we see that depending on the concentration, so we increase the concentration here from 5 weight percent to all the way to 30 weight percent, we see a strange thermothickening effect, which is a little bit unusual. And then eventually it actually forms a gel. Now, just for a comparison, if you look here, this is Pluronic 10 weight percent. So Pluronic has a very high viscosity at 10 weight percent. And this in our hands can represent a problem when you want to pipette it, for instance, when we mix it with cells. In contrast, our 20 weight percent, for instance, has a much lower viscosity, and this kind of material can easily pipette and, for instance, mix with cells. Now, if we go to 20 weight percent, we do actually rheology, and there, thanks a lot to all the earlier speakers that they explained so much about rheology, so I don't have to do it. What we see in our material is that the loss modulus here increases at around 15 degrees centigrade steadily, but then all of a sudden at 27 degrees, the storage modulus actually increases massively over 4 orders of magnitude. And here, of course, we have the gel point. And then once we exceed this temperature, the rheological properties are relatively stable. And you can see also this is a very clear gel, which of course is nice to be able to look into the microscope at anything embedded. We printed also with cells, so this is a viable bio ink at 20 weight percent. This is in this case only NIH3T3 cells, and all the green dots are basically living cells. Now, we looked at the rheology again, and basically the idea was, and this was in collaboration with collaborators in Bayreuth, to understand the flow profile in the printing needle. So what you can see here is like a mimic or like a model of a printing needle with a diameter of 200 micrometers. And if you have a Newtonian fluid or a relatively low shear thinning fluid, you would get something like this parabolic flow profile with a lot of shear stress over most of the volume of the cannula of the printing needle, but only in the middle you would have relatively little shear stress. And shear stress is something that many people believe is quite critical for cell survival or for cell viability. Now, if you have a flow profile like this one here, where you have a very, very strong shear thinning characteristic, if you fit a power law fit here, you get n values for the power law exponent of 0.03, and the closer to 0, the smaller this is, the stronger the shear thinning is. What you get from a flow profile is actually something like this. So you get a very high velocity difference here at the very borders of the cannula, but then the rest of the volume actually, which is the most of the volume, though you don't have any shear stress for the cells. So it's quite safe now to have the cells in here. They don't see any shear stress. Only at the very little bit of the volume on the sides, you actually do see shear stress on the cells. So they might be damaged or they might not like it too much, but the volume again is very minor. Now, if you're interested in probably doing that yourself, that kind of analysis, there is a tool that these guys developed, and you can access it here, where you can basically just, if you have the rheological data, you can actually model the flow profile in your printing needle. Maybe this is interesting for some of you. Now, this was a thermogel or a polymer that actually gels when we heat it up. So at cold temperature, it's liquid. At room temperature or at body temperature, it becomes solid. What we recently stumbled across is also a gel that does the opposite. And for that, we basically developed or have a tri-block copolymer now, where the hydrophobic part is in fact built from these aromatic units. This again was not designed to be a bio ink or a biomaterial ink, but it actually was designed to be a drug delivery system. But by coincidence, we just found that this is actually a very nice ink material. And what is interesting from a chemical or fundamental point of view is what the self-assembly of these polymers, what is going on there. And the smallest change in the chemical structure, this is a benzyl oxazine, and this is a phenyl. This is a benzyl oxazine, and this is a phenyl oxazine. So you see there's only one methylene group difference here. But this changes completely the rheological profile and the self-assembly. So this material here only forms spherical micelles, very small spherical micelles, and this retains liquid character at all temperatures. But this polymer actually forms these worm-like micelles, and you can see this kind of resembles maybe a little bit pictures that we've seen before from other bio inks, from natural polymers. But in this case, these worms are actually made from self-assembly of these individual polymer chains. And this self-assembly is thermoresponsive. So in the cold, when you cool it down, these worms form. When you heat it up beyond about 30 degrees centigrade, they actually revert back to spherical micelles and the ink becomes liquid again. We did a lot of rheological profile. I don't have time to go into that, but it was very good to see that, you know, we all agree that rheology is a key to understand printing characteristics. And I think we need to have a discussion what good printability actually means, because I think it's everybody a little bit designs themselves, but the talk from Åbo Academy was really nice in that respect. So here with changing the weight degrees here, loading, we can play around with the yield point, but that's not so important. These retain a very, very high shear thinning, and the probably most interesting fact in this, or fact for this material, is that the structure recovery is extremely fast. So once you remove the shear stress, they recover immediately back to a very solid-like material. And this now, of course, helps us with printing. And I just have a movie here how this prints. So you can see that it extrudes very, very nicely. It becomes solid again very quickly, and we get this very nice printability. Now, you wonder maybe, why do we even talk about this? And because 10 or 15 or 20 weight percent, we don't typically want to have this high solid content in bio inks. I mean, there's just the last talk we heard bio ink, the acetylated and nanocellulose that can actually print nicely with 0.5 weight percent. So this is, of course, a completely different ballpark. What we believe that these materials are interesting for is to improve the printing of other biomaterial inks that are very interesting from biological perspective, but maybe not so well printable. So this is a publication from somebody else, but basically just where they did add leponite as a radiological modifier, which is of course well known. And here a picture of what we did when we compared directly in alginate, which is of course often used as a bio ink and then cross-linked with calcium. So we print directly alginate, and under the same conditions, if we add in our polyoxazolin hydrogel, we can see that the printability really massively changes and improves. And this is just basically what I want to end my talk with today, is that we did this, we mixed our hydrogel with alginate to weight percent, and then we could print this when cooling down. And then when basically washing it and adding the cross-linker at the same time, but you could also think about, of course, UV cross-linking, for instance, you can wash out our polymer, which is basically a sacrificial ink in this case, but you retain the structure really nicely. So here you can see 300 micrometer thin strands where you don't really have any fusion, quite stable. And we believe this could be interesting for some of other people's inks as a support material, and these create really nicely and mechanically quite robust materials. So this is a cube with about 200 to 300 micrometer strand diameter from 2% alginate that was printed with the help of our inverse thermogelling bioink. So in summary, we actually are chemists. We synthesize polymers, we do test them rheologically, we test printing, but we don't really do bioprinting ourselves that much. For that, we look for partners, maybe in this network here, and I'm certainly would be very happy to expand my network of collaborators here in Finland. We focus on synthesis and a deep mechanistical understanding and fine-tuning of the materials, because that's what we probably do better than to attempt actually being biologists. I could only present a little bit of our work. We have 7 new different regular and inverse thermogelling bioinks. From transient and permanently cross-linked, we typically see very good cytocompatibility across a range of different cell types, excellent co-printing with other bioinks, and we can also easily modify with other functional groups such as maybe proteins, peptides, fluorescent dyes, and so on and so forth. And with that, I'm at the end of my talk. Here, just the slide again for the people who actually did all the work. And with that, thanks for your attention.
Hello, everybody. My name is Hassan, and I'm a PhD student in Biocenter Oulu in Laureate Group. I got my bachelor's degree in chemical engineering and then master degree in biomedical engineering. Then I worked for 1 year in a 3D bioprinter company, and then I started my PhD here in Biocenter Oulu in Finland. This PhD training is funded by European Union Marie Curie program, and our network is called VACure, or Vascular Anomalies Cure, which consists of 7 academic laboratories and 2 companies. On the left, you can see our first meeting in Brussels. Up to now, I've been providing different in vitro and in vivo models, enabling us to follow the interaction between the cells in vasculature, mostly, endothelial cells and smooth muscle cells, the interaction between those cells. Up to now, we got good results from the asteroid model, and now we aim to use a perfusible structure, which is more realistic. And here in this presentation, I will talk about part of my experiments with Bioprinter, and then review other strategies from other articles in vessel bioprinting. So let's talk about the vascular system briefly. If I want to briefly describe the vessel structure, there are several layers of cells like endothelial cells, smooth muscle cells, pericytes, and also different extracellular matrix components, based on the location of the vessel, but most of the biomaterials, there are collagen type 1, type 3, type 4, laminin, and other components. So the idea here is to fabricate a perfusible construct and having all these cells embedded in the ECM to have the best model for vessel mimicry. You can see our model on the right, where we have 2 layers of biomaterials and a hollow inside. In model A, we can embed both endothelial cell and smooth muscle cells in cell-laden bioink. And in model B, we can have 3 different cell lines, 2 cell lines dispersed in the bioink, cell-laden bioink, and coat the inner layer with endothelial cells. On the right, you can see how we mimic the vessel with core shell model, and it looks like a real vessel. You can see how nice endothelial cells are encircled by smooth muscle cells. And it affects their interaction for sure. This bioprinter is provided by a Brinter company, which we bought last December. As you can see here in the setup, we have a 3-axial nozzle. We aim to print this hollow structure which I mentioned. This 3-axial nozzle consists of 3 nozzles inside each other. And we want to print in the most inner part, we want to print a liquid cross-linker, which both cross-links the middle layer and also keeps the most inner part unfilled and makes it hollow because it's coming out and it doesn't remain. This structure is perfusible and valuable in vascular modeling. This year, I optimized the concentration of our own 2 bioinks, the fluorates, to get this uniform structure. Besides the concentration of the inner and outer cross-linker and also time of cross-linking is very important and tricky. The cross-linker concentration, it shouldn't be too high because when it's high, the outer layer cross-links rapidly and shrinks. And when it shrinks, it doesn't allow the cross-linker to diffuse and cross-link the whole structure. On the other hand, we should be careful that it should be high enough to maintain the tubular structure, because when it's not high, then the whole structure collapses. I mean the hollow structure, and it gets blocked, and it wouldn't be perfusible anymore. Let's take a look at these videos. Here we can see 2-layer and 3 layers of hollow structure printing vessel, and we embed endothelial cells expressing GFP and smooth muscle cells expressing TD tomato, which allows us to track those cells. Here we can see the final structure after printing and also the cross-section image. The thickness of the hydrogel wall and also hollow diameter is to some extent adjustable by changing the concentration of the material or even by their flow rates. Also in the video, which I will play now, and I ask you to take a look, in this video we can see the perfusion, which is something valuable and enables us to evaluate the interaction between the endothelial cell and the smooth muscle cells in the presence of this mechanical stress, which is caused by flow. And we are going to use different gene mutations in the endothelial cells for vascular anomalies. Also, from this slide, because I reviewed quite many articles, and as this presentation is about vascular bioprinting strategies, I'm done with my own experiments, and from this slide, I just talk about one article, and I also talk about 2 other approaches for printing a perfusible structure. In this article, which is from MIT lab, here they developed a new bioink by combining the benefits of both synthetic polymers and natural polymers. And many new materials like gelatin, collagen, hyaluronic acid alginate, polyethylene glycol, there are quite many that have been used individually as bioink because they are biocompatible and they have sufficient viscosity. But none of those materials alone offers properties suitable for direct printing of perfusible hollow tube, because the strength is not enough, and when we print the hollow tube collapses. There are some other bioinks like polyethylene glycol, mechanically tough, but they don't have cell binding sites, which is needed for cell spreading and proliferation of the encapsulated cells. Here in this article, this bioink is really novel, and each component plays its own role, as I will explain here. Basically, for this perfusible structure, we should have alginate because its cross-linking reaction is rapid, because it's based on ionic reaction. But we know that UV cross-linking reaction, because it's a covalent reaction. It's slower when we want to expose UV and cross-link Gelma, for example. So alginate is one of the components. Gelma is another component here, and Gelma was used because it provides cell binding sites and improves cell viability and allows cell spreading. Another material in this bioink is PECTA for arm something you can see on the slide. PECTA also used to increase the mechanical properties of the final structure, because here when they wash away the alginate, the mechanical properties of the whole structure decreases, and it's not enough anymore. So let's go to the printing process. As you can see here, calcium chloride solution was printed in the core part and bioink in the shell part. Alginate is cross-linked rapidly with calcium chloride solution, and then UV is exposed to cross-linked Gelma. And the new idea here is to remove out the alginate from the structure by immersion in the EDTA solution. And we know that EDTA is a chelating agent, and it takes out calcium ion from the structure, and then alginate is not cross-linked anymore, and then we easily can wash it away, as you can see in the image on the right. The red color in the structure shows the alginate after different time intervals after being washed, which shows its gradual removal. Let's take a look at this video, the final structure, which is really valuable. In this video, I guess this one is very, very valuable because I've never seen such a big perfusible structure. So now I switch to talk about two new strategies. So what is fresh bioprinting? If we do printing in a sacrificial hydrogel, it is called fresh bioprinting. Mostly the sacrificial layer is pre-cooled low concentration gelatin or pre-warmed fluxamer. This method is useful when the 3D structure is complex and we need to mechanical support. The sacrificial layer is used as the mechanical support here, which after the printing and cross-linking our desirable part, we can remove the sacrificial layer. So let's take a look at the video on the right. Basically, without using the sacrificial layer, it's almost impossible to print such a complex structure. Oh, sorry. Yeah, now explained. I guess the mandible, the presenter from Tampere, showed it was also printed with this fresh bioprinting method. So this one is quite new. That's 4D bioprinting. So the last idea is 4D bioprinting, and that's a little bit funny, but the first question which comes to our mind is that what does the fourth dimension mean here? And it's time. But how time relates to printing process? In this structure, here the printed structure, I mean in the 4D printing, it can change its shape or functionalities with time. When an external stimulus is imposed. There are many examples, but I found one vessel printing which looks very simple. And the idea is from apple peels, as you can see here. So what happens here is that peel consisting of two layers, one layer of apple and other layer of the skin, and those have two different bending properties when they dry out. So in this article, which used the previous idea, they printed a simple strand, then they exposed UV and then just left the structure to dry out, and then they put it in PBS or any aqueous media, and then the structure bent over itself and made a tubular structure, as you can see on the right, the LCM images. It's a piece of cake. But the question here is that why it bends? Because it's not like the apple peel, and this one is just only one material. To explain this behavior, they claim that the reason for self-folding is the crosslink gradient in the structure, which is formed because when they are exposing UV, because the top layer of the film is more crosslinked than the bottom. In top, the crosslink chains are denser. So when we put it in the water, the bottom absorbs more water than the top, and because it absorbs more water, it expands. Both of them expands, but the bottom expands more and force the structure to bend. And that's how in this article they made this tubular structure. So I hope this presentation was useful for you. And I'm done with my presentation.
Thank you, Hassan, very much for your interesting presentation.
Hello, everybody. Greetings from Lapland. So I sent a talk by remote videotaping, and I will tell you about our kidney-related applications and how we use the tissue engineering and eventually the printing applications to take use of our skills. So this illustrates, this first figure, actually a situation where we can do 3D imaging of the exact tissue landmarks that make the embryonic kidney in this case. So this red color indicates the collecting duct that is developing, and then these green ones, actually those ones that filter the blood, so representing the glomerulus. So with these kind of maps, we can then use these digital kind of data stacks, and then use printing actually to print distinct parts of the organ. So basically here we have a printed ureteric part that is based on our Cree-based mediated fate mapping of the cells, and that make the collecting duct that we see on the left as red one. So this is basically showing the fundamental with these kind of approaches based on 3D imaging, on the optical tomography techniques, for instance, so we can then get the maps that actually give us exact spatial positioning of those progenitors that make the kidney. So then there's actually lots of techniques that we can use for aiming this kind of purpose, and then developing inks that are offering positioning of the cells and holding them in distinct positions. So we can decellularize the kidney as an example, so it's shown here that you can then use SDAs and other means to wash out the cells, and what is remaining in this CND figure is basically those matrices that then actually make the scaffold of the kidney. So then we can powder this and then use that as an ink together with cellulose application. That is one of the prominent topic of this meeting. So then these are sort of giving us the actual true vehicles that are then offering these bio inks to be used in this bioprinting process. So this shows the actual strategy in a form of cartoon. So you have then this xeno transplant situation where you envision that you can actually humanize pigs or other sort of hosts that would then carry similar mutations that are kind of very targeted to a very fundamental gene that regulates, in this case, the kidney, and then you replace these wild type cells by blastocyst injection. And these are techniques that are widely used, and then in our case, like in Oulu, we have a good center that can master these techniques, so illustrating this kind of overall scheme of opportunities and also ways to make the matrices that then serve as scaffolds for stem cell channeling. So we have also very good tools available for mapping actually all the lineages, so we can now map each and every cell type actually that makes these distinct anatomical compartments, and this illustrates a few of the Cree lines that can permanently label in the floxed mouse models the lineages that then define specific anatomical structures. On the left you can see the ureteric part that makes the collecting duct, and in the center you see a kind of pretubular kind of active in these green cells, and then on the right side you have these stromal cells. So we have similarly also other types of ways to mark specifically and permanently these distinct cells, and then this can be fax purified for the printing purpose. So this illustrates then our powers in the kidney, that we can also use a very classic technique for organ growth and organoid or organ primordia growth in explant culture that we've been doing for the past quite a number of years from Lower Saxon's laboratory. And then this is showing you the powers that we can also bring in genetics, where we can then wipe out the distinct cells based on expression of gene targeted diphtheria toxin as an example. So then this offers us to also kind of take use of this printing and also integrate distinct cell types based on this assembly process. So then we have also developed kind of new ways of targeting individual cells at the single cell level, basically. So this illustrates these techniques that is based on classic microsurgery, and then we dissect these tissue compartments separately based on microscopic inspection, and then we go and dissociate the individual cells that are containing these pretubular nephron stem cells that are then going on to construct the nephron, and then we can use fax depletion, adding distinct sort of fated cells to this, or using lineage tract cells that are coming from all GFP kind of founder cells, for instance, and you can then reconstitute the kidney composed of individual cells, one single cell that comes from a certain lineage, and then also you combine the printing purposes here at this stage. So this illustrates some of the powers that we can reconstitute the organ together with the vasculature that is based on Taiwan Cree-marked or kind of flocked cell lineages, and some of our old movies just show the powers of the system that we can use. So then if we combine these techniques together with the kind of cell depletion opportunities, so we've actually mapped the stem cells or the progenitors that make reconstitute or actually that make the whole kidney vasculature system, and these are kind of experimental schemes where you can then use sort of antibodies that are marking your progenitor of interest, and then you can use this fax depletion that dissociate the organ primordia prior its formation, then you can reconstitute the organ to put it together. So then we've also developed for printing purposes sort of pancake or sort of fixed Z dimension cultures, where you basically can compress the early primordia so that, or the organoid, so that you can enhance the oxygen exchange and a gas exchange collectively. And this illustrates though that you can really actually enhance the development of the organogenesis, and this again shows these glomerular cells that are kind of doing the filtration, and then this red ones are the collecting duct, which actually also marks the nephron segments given this cytokeratin staining. So then all these things can be then stacked together in terms of the printing, together with these artificial materials that come from nature, like cellulose, but also the normal matrices, and then we can place these into cultures so that we can vascularize also endogenously and provide the blood flow into the system. And this illustrates those experiments where we can use the chicken as one vehicle to basically introduce vasculature with flow into these reaggregated, reconstituted and printed organs. And we have published papers on this where you can really study also multiple organs and the interactions based on communication technologies, and study organ targeting principles and things like this. So then we come to the printing more exactly. So we are using kind of approach where you do stacking. So these kind of pancake organs that are made based on the progenitor cells that are programmed are then put together in between these intrinsic kind of immortalized cells that are conditionally putatively immortalized, that you can put them together and then stack these like kind of pancakes on top of each other and making quite a more substantial organ. So then we have also learned to program the progenitors, well, actually the stem cells, like the mouse embryonic stem cells. So we were actually the first to come up with the recipe that you can really direct these sort of pluripotent cells to specific cell lineages. And then this is based on these inductive interactions that we have studied for years. And actually, if you are interested, so you can look my book. So there's a kidney organogenesis methods and protocols that illustrates much of these techniques that I speak about. So that's more or less the kind of kidney side of things, and then this illustrates these powers of the technologies that we can kind of bring together and to create value for the process. And there's really a massive need for kidneys for diabetic nephropathy reasons, but also many other ways. How you have acute kidney injuries and degeneration towards the complete failure of the kidney. This is really a substantial problem, including COVID-19 currently. So just a few words about the skin. So actually couple skin printing and you sort of the kidney systems being our FET open programs. We kind of developed communication platforms between these organs eventually, and then this is based on a paradigm that we then engineer also in situ intrinsic stem cells that reconstitute the organ indicated here in this cartoon, where the stem cells are then programmed, and then this offers an opportunity to insert a tag. And we've been studying this skin as a sort of sensor for glucose and many other features of the bodily functions. And then we use here also printing. So the aim that we work towards with many of our projects, funded projects currently, is to basically use the skin printing and reconstitute skin. And we have kind of nice strategies assembled together that integrates organ engineering and stem cell engineering and gene editing and kind of nanovesicles and many other features to a collective framework that we try to translate into the clinics to advance really monitoring of the bodily functions. So then finally, the aim that we have is illustrated here. This is a bigger framework of a bigger network in Norway, and it's a global network that we put together, that we kind of envision that this bigger dimension where you make this kind of human on a chip based on this programmed organoids that are now available based on distinct recipes, so you can bring all this together, and also the data stacks that are coming from kind of vital live imaging of humans that are based on MRI or PET or other 3D kind of imaging modalities, and then you bring these together to a kind of bigger framework of actually making a mini human being that then will be rejuvenated, so that we envision that this rejuvenation actually recreates life based on the digital paradigm of this kind of digital data stacks that come from the kind of medical bioimaging. So, I mean, that's more or less my story, and greetings from Lapland, where we are now skiing. So I hope that you enjoyed this talk and you basically got some idea about how we can use the kidney creatively and together with these kind of classic and modern techniques and their combinations, how that offers ways to use stem cell programming and also progenitor depletion and reconstitutions of the organs from single cells, how we can then use gene editing based on the CRISPR approach to also insert distinct sensors into these reconstituted organs, and how we can use the decellularized kidneys to basically use them as printing materials together with interesting materials like we hear in this meeting, obviously the nanocellulose, and it's a kind of functionalization which we work together with Henrik Liimatainen in Oulu. We've used nanocellulose, so it's a pretty nice this Grodex applications, and they really have their powers, and we are definitely going to use these more and more into our context of interest of doing this kidney printing. So then I think that these techniques are really important for research purposes, but also for translation into the clinics, which is our strong aim, and we are going to use these for helping eventually the patients with diabetic nephropathy and others that then we need for kind of a transplantable kidney. And this is now prominently funded by Roche, that they put really substantial grants on this area, plus also there's now an open call for Kidney X in USA, where the aim is to bring together all the expertises that we have in this community to advance really the field to come up eventually to functional reconstituted organ or recovered organ from even a genetic lesion. That is the case in for instance, nephrotic syndrome of the Finnish type, where nephrin 1 gene is kind of mutated in these patients. And there's now nice opportunities in Finland based on this FinGen way we will get public awareness of this GWAS data that comes from 500,000 Finns. Okay, enjoy your time and on this meeting, and if you have any questions, so please send me emails. It's seppo.vainio@olpista.fi, so you can call me also and we can discuss more. So thank you and enjoy your time in the meeting. Bye.
So thank you, Seppo. I don't know if you're connected right now, but you got the information, and also on the Tissue Cure Alliance homepage, of course, you can find more information to all our speakers. Okay, we go on with the next, and that is Mika Jokinen. Please, Mika, your turn.
Okay, I hope that you see my presentation now.
Yep.
All right. So before going to the actual topic, which is the design of materials for 3D printing of drug delivery device for biological drugs, so I would like to tell some words about the organization or the center of expertise I represent here. And this is abbreviation is MAM, and it's a center of expertise that is related to additive manufacturing and 3D printing, and we concentrate on the multi-component materials. And this MAM is a kind of collaboration forum between the universities in Turku and companies. And of course, everybody is welcome to collaborate with us. And we have also made some investments, so we have bought quite much different types of 3D printers, and our main application area is actually medical biomaterials, and there are also other more general aims which are related to general design of 3D printing. And in my own research group, so the focus is actually quite much in biological drugs, but we also deal with small molecular drugs. And the driving force here is for us to do something with 3D printing. We are of course interested also in bioprinting, but also this personalized medicine is actually one of those things that gives a little bit pressure on the development of different kind of customized drug delivery devices, and as do this increasing number of biological drugs. And our materials that we develop for biological drugs, so they are usually hydrogel-based composites. So there is at least one hydrogel phase, and these are certainly also applicable in some bioprinting applications and in tissue engineering. In addition to this, we also within MAM, so we do 3D printing. So for dental prostheses, for example, we deal with complex fiber reinforced dental prostheses, and also metal 3D printing for dental prostheses. But okay, now to these pharmaceutical applications, and you have actually heard quite much about rheology already, and now you hear again. Maybe a little bit new things also, but partly also the same as you have heard already. So it's very interesting to see that many people are working with rheology, and I see also a lot of collaboration possibilities here. So we have an approach in our design of materials for biological drugs, and it is the same for small molecular drugs actually, that we do a lot of rheological characterization, and we combine simulation then on this rheological data to understand how we stabilize the materials before printing, how we make them shear thinning, and also this how they recover after the 3D printing. And why we do this 3D printing, and why we deal with customized drug delivery. So yes, 3D printing is actually quite potential for this new type of personalized medicine applications that are coming, and in customized drug delivery. So it's quite easy to make tailored structures and complex shapes with with 3D printing. And it's also quite easy to test different kind of personalized doses of drugs. And we can also put several different drug molecules in the same implant, for example, or the same hydrogel, and then they result in different types of co-release or delayed release or pulsatile release. And I know that this is sometimes also needed, these different kind of drug delivery profiles, also in tissue engineering applications. But there is a specific challenge for us because we are mostly interested in biological drugs, and it means usually that we have to stay at the room temperature processing, but we have to also achieve then for this hydrogel type of composite long-lasting drug delivery. And this long-lasting, I mean, when I talk about long-lasting, I mean that it's at least for several months, this release time. And how we do it then, so I try to do it, so we are using different kind of biodegradable ceramic and polymeric hydrogels or composites of them. And then combined with those, we have some different types of particles, and those particles can be ceramic particles or polymeric particles, or they can be other hydrogels, which has different properties than the main hydrogel phase. And because we have to actually really, when we change a lot of different things and we have a different components in our materials, all these components change already the properties of the material, and they change the rheology and so on. And then this is a big issue to really find printability for every type of material combination. But we have to, at the same time, when we deal with this printability and adjust that, we have to take care that biological activity is preserved, and also this long-lasting release must be achieved. So it means that we do currently quite much adaptation of different kind of biomaterials to 3D printing. You have heard about this rheological things already. There is one more thing that we at least do that the others have not mentioned, because we are studying these different materials also before we 3D print them, because very often we have dynamic materials that they are not stable for long times, or we have to use like a dynamic materials so that they might be stable only for half an hour or something like that. So we are also very interested in what happens for the material prior to the 3D printing. And that we study by oscillation, of course. And then we study also these flow properties in the nozzle. So shear thinning is, of course, needed there. And then we study also how this setting is occurring then after the nozzle, and measure the recovery by different ways. And it means that this is a quite standard thing to do, this oscillation, rotation, oscillation sequences for rheology. But what we do, really, we try to use these rheological data for simulation of flow and setting, and by that way understand how our different components affect the properties of our material and the printability. And it means that there are quite much different kind of parameters. Actually, it's not only the material composition. There are also that we also want to test different nozzles with different diameters and different forms and so on. And we also test different pressures and different temperatures. And of course, this I already mentioned, as different material variations, and also the type of the drug molecule, they change very much the material properties, because the drug molecule itself may already affect the rheology quite much. And we do these computational flight dynamics simulations on these flows in the nozzles. And in different types of nozzles, you have different types of flow rates there and shear rates. So this conical one has a different profile than a cylindrical one, and so on. And then, as I told already, those oscillatory measurements, they are really studied also before printing and after. But we also then want to correlate these different kind of shear rates, because that shear rate, which is the result of many parameters, so it may also affect the setting properties. So the nozzle, if you change something, small thing, so you may also change the setting and the recovery of the material after the 3D printing. And this is a typical result. This is a ceramic hydrogel with a quite high solid content. And we study first by oscillation, as I told, so at how the material behaves just prior to the 3D printing, and we hope that it's quite stable, that the values are not increasing too much. Then we have this shearing phase, and if we do only rheological measurements, so we just make a rotational dynamic viscosity measurement, but we can also use high shear oscillation if we need higher shear stresses, or just by using real injection, so that we are injecting these materials onto the plate for the rheometer, so that we measure like a real injection shearing also. And then we study how these materials recover afterwards. And this material took some time to recover, but it was already at the very beginning non-flowing, so quite well printable, so from the very beginning. Okay, that was shortly everything from my part, and I thank you for your attention.
Our next speaker will be Isabella from Cellink again.
This 15 minutes I would like to take to do a demo to show off the system, and also to take a closer look on the different printheads that we have available, and how you actually do to set up the bioprints. So here we have the BioX bioprinter that is together with our BioX6, our flagship bioprinters. And from the exterior, you can see it's fairly small, and it has a low laboratory footprint, and it's very easy to fit anywhere on the bench or in a loft bench if you like to print, or when you would like to use this for sterile printing. You can also, you have the HEPA filter. It's a proprietary clean chamber fan technology we have that maintain a clear or clean environment within the bioprinter. And we also have germicidal lamps up here on the top of the bioprints. On the front, you have the touchscreen that's very intuitive and easy to work with, and I will show you how to very easily and straightforward set up a bioprint. We have the print stage with also temperature control. You can cold down to 4 degrees and heat up to 65. We have our new ultrasonic automatic calibration sensors, so it means that you can do the automatic calibrations touchless. And we have the interchangeable printhead holders sitting up here, where you very easily can mount on and off the printhead you're looking into using. So you can take your standard pneumatic printhead off and, for example, put on a temperature control printhead if you instead would like to have a more precision and control over your temperature. There we go. You can also very easily remove the air adapters if you, for example, like to use our syringe pump printhead instead, which is driven and do not rely on the pneumatic pressure for the extrusion, and therefore has a the possibility to set the extrusion volume rather than a speed and a pressure, to have the printer printing exactly the volume down to 1 microliter that you would like to use. There we go. So just pump this one back on. So this is standard cartridges. You pop them into your printhead and lock the air adapter on top. You can have the printhead holes here for 10 ml as well as for 3 ml, which is the standard. If we take a look at the printing screen. I will take and turn off the lights, I think. Give a quick access here to the menu so you'll see with less glare. There we go. So when you are to begin your bioprint, you have three options, more or less. You can go directly to bioprint. You can go droplet print, which is this print mode where you can dispense droplet to have a high replicate of samples of the material and cells. Or you can start from a saved protocol if you know that you're printing more or less the same structure several times. If we start a bioprint, you will access the files that you have inserted on a USB stick that you have here on the left-hand side. And you can select folders and have a preview of your constructs. This preview you can twist around, zoom in and out. This is a box, so it might not be that exciting to zoom in on, but if you, for example, have a more complex structure, like ear here, it would be interesting to see, oh, is this really the defect here that I was looking for? Today for the demo, I think I would like to print a cylinder. So I will choose this model and follow a workflow down here at the bottom. That's it. That will bring me all the way from the selection of my model to the print in 4 easy steps. So the next thing we will do is that we will continue to select our surface. And here we have some standard options set up. You can either go for the Petri dish, or you can select a well plate. And with the well, you can also select the vendor to have the position between the wells. You can also custom your well plate if you would like a specific organization. You can also select which wells you would like to print in. So I can clear the selection and say, oh, in this 12 well plate, I only want to print in the 2 in the middle. And then I'm happy. Let's continue with the Petri dish. When you have selected your print substrate, we'll jump to the printer setup, where you can select the temperature of the print bed. You can turn on photo cross-linking, and you can have it once or layered in between layers if you would like to have a closer frequency of the layers. You can activate the printers you would like to use. And for this demo, I think I would actually like to use all of them. So I'll just turn them on. On the printers, if you have used the nozzle recently, you will get pre-selected values. You can also select from a profile. If you don't know right now what pressure you would like to use, you can leave it and you'll test the extrusion later on. You can also add a pre or post flow delay. And this is because, as we've been discussing very thoroughly during this talks, is that a bioink has a mass. And if you have a viscous bioink, it might take some time before it actually gets extruded through the nozzle or the needle. So we do not want the printer to start moving, for example, until the ink has had the time to actually start flowing. So that's what you can add in with the pre-flow delay, for example. You can very easily go up and down with the speed, depending on what you want. Select your layer height, or which will correspond here to the nozzle or needle inner diameter. You can choose from the preset of gauge sizes or specify your own. Great. When you are happy, you can also set the temperature for the printers. And the layout here will vary a bit depending on which printer you are using. If you are using the syringe pump printer, for example, you would get you wouldn't say select the pressure, you would rather select an extrusion volume. When you're happy, we'll jump over to the layer tab. And this is where we can select how we want our construct to look like. Very straightforward on the screen. So you can scroll through the layers, and in this model we currently have 7 layers. You can select infill pattern from a few preset infill patterns. You can also change the density. Maybe if we go down to 15, we can have a look on how that looks. And you will, in this preview, always see how your settings affect the printing pattern that you're looking to have. We can also, if we want to print a hollow cylinder, turn off the infill, and we will not have any infill. And it's very straightforward to also select layers on the directly on the printer. So we can choose to use either of the printers for all of the parameter or all of the info, or we can choose alternating. So here I can select which printers that are to be printed on the specific layers. So for example, we could do like this. So we print 3 layers with the first printed, then 2 layers with the second printed, and 2 layers with the last printed. And now my preview will be updated, so I can see that my first 3 layers are blue, corresponding to the first tool head. My second 2 layers are red, corresponding to the second tool head, and the last 3 are green, representing the third printed. This will bring me to the summary page, where I just looked at everything looks like it's like I want to. If everything's green, everything's fine, then you have not selected anything that's not corresponding to the printer at the moment. For example, if you took the wrong printer, it will tell you like, no, that's not the printer you have on at the moment. You have the option to either go direct to print now or to actually save the protocol if you would like to set it up again without having to put in the parameters. Great. And then we're ready to print. Good. So now with the calibration, we have the automatic bed leveling. And for this, I need to attach this surface probe extender. And what this does is that the printer calculates the print substrate. If you have some issues with, for example, not an issue, but if you, it checks that the print substrate is a leveled surface and calculates for any tilting within the substrate. For a well plate, that's or prejudice is maybe not as necessary, but if you're printing in a well plate, there could be differences between the first row and the back row of your 96 well plate, for example. And now I will turn on just a little bit of light, so you will be able to see what's happening in the printer. And the light is tunable, so you can bring it down. This is good if you have light sensitive materials, because then normally everything in the laboratory is dark. And if the print is dark as well, then it gets very tricky to see what's happening with your print. So you can bring it up to just a 1-2%. Or for now, when we are in the Lightroom, we can bring it up to around 20, so you can see what we're doing. The calibration is very straightforward, no matter if you do the manual or the automatic, where you very intuitively use the arrows here on the screen. And now it's a lot of glare since I turned on the light, but there are the easy touch connection, which very straightforward will ask you to bring the printer closer to the print nozzles. And you can change the step size depending on how your precision and how far away you are from your calibration point. So we can go like this, and we'll say that that is a good calibration, and let's calibrate. And even if I'm now working with 3 printheads, it's very smooth to bring up the print bed. Place the nozzle at the correct set height. And press calibrate. And well, there I'm happy. And we're ready to start. Since you're printing with bio-inks, these have a tendency to dry out in the nozzles unless you have been very fast. So this is us during the print. You will always have access to a menu where you can access the printing pressure, the printing speed, the temperatures, and so on. So you'll have the flexibility to test them any time and also adjust them live while you are printing. There we go. Good. And then we hit start. Great, there we go. The printer will now turn green, and so you're done. And here we have our cylinder. Now, if I want to print again, I can simply take a new Petri dish and hit the restart button here at the screen to print another one. But with the time that I have, oh, I'm already over time, right? Okay. Yeah, so that's how easy it is to set it up. And if we have just a minute, I will share a quick video of when we are using the BioX6 in action with all all 6 printheads in action. So there we go. Here we are. I think you all can see that. So here we aim to print actually a skin tissue model using the coaxial feature, the temperature control printhead. And this is what we're printing here is the base with the Jelma base bio-ink. And therefore use the temperature control printhead to be able to precise the temperature. Then we'll go down with the coaxial printhead to print a vasculature channel in between this base. And then we will use a Cellink formulation that do not need temperature control to print a layer on top of the vasculature part and also bring. And then we'll have the Cellink pumper go in and precisely dispense a specific amount of liquid or cell suspension patented over the area. And then we'll print, actually it was a skin model, so the last part were let's say hair follicles that you pattern or melanocytes, and then you can have the keratinocytes matrix, either cell suspension or low liquid bio-ink dispensed on top with the EMD inkjetting printed.
So my name is Johanna Kuntsu-Vakalio, and I'm the director of UPM Biomedicals. And I'll say a few words about nanocellulose for regenerative medicine. UPM Biomedicals is part of UPM Kymmene Corporation. We are a forest industry company, more than 100 years in the stock exchange with 18,000 employees, 10 billion turnover. And UPM Biomedicals is actually one of the new features or new businesses for UPM. And what we do is we are actually producing nanofibrous cellulose for medical and life science applications. And of course, we don't do this alone. We collaborate a lot with universities, research centers, and especially also with key industrial partners. And today is my pleasure also to actually refresh yesterday's press release that I think many of you have already noted. We have entered into a collaboration with Cellink, and we are planning to bring together some of these revolutionary bits. So from the high quality nanofibrous cellulose from our side and the 3D bioprinters from Cellink and their technology related to applications to actually make this true, not just to stay in the academia, but make this into something that is repeatable and can be used in hospitals across the world. But where do we start from? As said, we are a forestry company. We start from a tree. We start, in our case, from a birch tree, which is then traditionally processed into cellulose. And we then continue, refine it further into nanocellulose. Nanocellulose fibers are then applied in these life science and medical applications, and that's our core business. As said, this nanocellulose actually in our case is a gel. And we started already a long time ago, first with the processing and the IPRs around that area, and we started with research applications. So there was no standardization needed, and this is what you see all around the world. A lot of researchers are playing around with nanocellulose. In our case, we really focused on the manufacturing to make it reproducible, make consistent composition, a homogeneous product, and obviously, as it is birch, it's naturally animal-free, so there is no animal DNA, just the birch and water. Then it took us several years to achieve the ISO standardization 13485, which is for topical application in human. We are using the nanocellulose for wound dressings, and for this to achieve, we had to pass biocompatibility tests. So we have genotoxicity, cytotoxicity, sensitization, irritation tests, and so on. But we don't stop here. Our target is obviously further into the future, and that's that we will be able to have also applications that go inside human. And in that case, we are talking about systemic toxicity and control degradation and so on, which are related or required for the use in human, whether it's implant or whether it's additive for pharmaceutics or whether it's some other interesting innovation. So our targets are far into the clinical. As said, we don't do this alone. We have more than 60 ongoing projects with academia, with industry as well. And in these projects, we develop a lot of IPR. Currently, we are protected with more than 300 patents in this field. So every time you see nanocellulose and you see some cells in it, you know that you are within our portfolio one way or another. So what we have today as our product portfolio is actually all based on the birch nanocellulose. And the oldest product that we have on the market is actually Grodex, which is a gel which is used for 3D cell culture. Then we have introduced Grow Inks, which is a range which is directly ready to use for 3D printers. And then we have Fibdex, which is for the wound dressing. Besides that, we have also OEM range of products, which I will return to in a while. But these are meant then for third parties to incorporate into their products. Our main goal is really to be the provider of carrier for cells throughout the whole manufacturing process, all the way into the patient. And that is actually something that we are striving for heavily. So as you can see, we have a whole path where We start from the gel in pathology, where you have a patient with a deficiency. It goes through the biobank or cell bank or hospital, where it is further refined. We have more than 150 protocols for different cell types. Then it goes through the bioreactors for cell expansion. We are compatible with pretty much every dispensing unit or lab automation unit there is on the market. Then you go through the fluorescence or microscopy to check that the right cells are actually going into the patients. And in this, again, our material is transparent, so we are able to actually see the cells and confirm what is there. Then you can select the route in which you want to apply the cells to the patient, whether it is to inject them directly in the gel, or whether it is on a wound dressing, whether it is 3D bioprinted, which why we are meeting today, or you can also decide to release them with an enzyme that we have, and that way you're able to just get the cells. Besides that, we have a little wild card up in our sleeve, which is freeze drying, in which case then we are not so restricted with the temperatures, and we also are able then to preserve the samples for longer periods of time and apply them in emergency setting. Last but not least, when you print and you have living cells in it, it's a pity to freeze it at that point. Instead, you can directly transport it either in the gel alone, or you can use an incubator where we are collaborating with a German company, Cellbox, to actually be able to deliver tissue still growing into the hospital and then apply it to the patient. Once again, big benefit, no animal DNA whatsoever. So all the things that are phasing out of the clinical, we are the things that are phasing in, or materials that are phasing in. This is just one example of this stem cell application into, in this case, in vivo into mouse. And here it has been actually, the cells were grown, in our gel, and they were modified with these pots, and eventually they're injected. So again, imagine you can grow the cells in the material and then also apply the cells in the same material, in this case injection, but same way you can 3D print them and then apply them into the diseased area. For the this side of business, it is led by Toni Kiuru, and actually Toni is also on the call, so if you have any questions, you can send them in the chat. As I already mentioned, we have more than 150 optimized protocols for different cell types, including stem cells, which I already mentioned, but also patient-derived cells. So, really these primary difficult to culture cells, they enjoy the possibility or the tunability of the environment that you can have in the nanocellulose. If you want to see any of these protocols, they are in our website, which you can easily access. Today we have in the life sciences Grodex, a range of products, which is Grodex, which is an opaque material, again nanocellulose, or Grodex T, which is actually fully transparent, and then we have Grodex A, which is functionalized with avidin and allows you to then pick specific cells or provide specific growth factors for the cells to grow in. And then have the range of grow inks, which is bio inks for 3D printing. And also here we have the same set. So we have the natural grow ink, which is slightly opaque. Then we have grow ink T, which is transparent and is cross-linked for tougher structures. And then we have a grow ink with alginate, which again allows the cross-linking. Besides that, we have also the enzyme grow days, which actually allows us to remove the hydrogel from the culture and keeps the cells intact. Here I have a little video showing actually the printing of growing. Also here you can see it's customizable, so we are able to have different stiffnesses for different cell types. You're also able to obviously do layers, as you can see. So if you're thinking there has been a question about how to print different types of cells, so you can always have them layer by layer. also has been seen in the Cellink video, and you're able to retain the shape of the material. And once again, the idea is of course not to stay in the lab, but actually go into the clinical setting, which means that you need a material that will be able to follow you to the clinics, and not something where you are playing in the petri dish and get a nice PhD and that's it, but something where you're actually able to translate results from the in vitro into the in vivo area. So here you can see fine structures with the media as well, surrounding nice. You can see the fine thin layers in the mesh. And what is nice also is that it's room temperature stable, so you don't have to worry about any cold or warm temperatures, and you are able actually really to do, as you can see here, multiple different layers with different stiffnesses, so different cells embedded. Here is the nice sandwich. That was a quick video of the growing. We have been printing with many different printers, but actually I think that's up to you what you decide to choose. I would like to spend a couple of slides on the OEM material, meaning that besides selling ready products, we also sell nanocellulose for third parties, as I have mentioned earlier. And we sell it in 3 different qualities. So in the structural quality, which is actually not meant to be used with cells, but rather for training purposes. Also in the in vitro quality, which is actually for work with cells. And finally, we are also having now in testing the in vivo quality, which is meant for implants and actually use in human. These are some of the key parameters. It's animal-free gel, obviously. It is reproducible, so all the differences in the results come from the actual cells, not from the material. It's not biodegradable in the body, but we can have the degradation done with the enzyme. It's biocompatible, as has been tested with all of these genotoxicity, cytotoxicity, and sensitization tests. And also it does not require REACH registration, which is important in Europe. And last but not least, why work with our nanocellulose? Number 1 is patents. If you are planning to really roll out your academic research into business, you need to ensure that you are able to work with the material also in the commercial setting, which means you need freedom to operate. So if you want to work with something that is protecting you and also your customers, we are the choice. If you are thinking of standardization, if you want to go beyond cell assays, meaning going into, let's say, areas where you need compliance, once again, you need to establish manufacturing to an industrial setting, which doesn't happen overnight. Every year there is audit. It's also not very cheap to maintain. So this is something that we have already in place. Also, if you want to translate the results, it makes it, we are approached from time to time by groups that are working with nanocellulose, and they say, hey, we have developed this modification, do you want to have that? But then it comes to the question that we have to repeat all the tests because it's been done on a third-party nanocellulose, so it's no longer valid for us, and we have to repeat all the steps and actually run the project again, which is not very, very useful. And then, of course, the translation from in vitro to in vivo, we already manufacture according to ISO 13485 for the medical devices, and we are on the path to standardization in human use. So again, if you are planning to go commercial, if you are planning to go towards in vivo, make sure you work with the material that is able to deliver. And that's actually all from my side. And if you have any questions, please send them into the chat or visit our website, upmbiomedicals.com. Thank you for your attention.
Hello everyone, my name is Pasi Kaskinen and I am the Sales and Marketing Director of Brinter, the Finnish 3D bioprinting company, or solution company I should say. Thank you organizers for allowing us this slot to come and tell the Brinter story of the young startup company. My own background is in biomaterials, more particularly in the area of forest-based biomaterials and technical training, international technical training, and building international sales and marketing organizations. And I joined Brinter last year, and that nicely fits my life's goal to be able to help improve and even save human lives. And what better way to do it than 3D bioprinting. Also, a part of this presentation, there will be a short video presentation or demonstration of Brinter in action. And hopefully in the near future, we'd be able to also give live presentations. Today already it's possible for you to contact us, and we'll book a online live presentation or demonstration more in depth of Brinter in action. Here you see the reason for our existence. So the Brinter basic idea, mission and values are to help improve lives via producing technology that enables that goal. The founders of the company have long experience with 3D printing and experience in automation, system development and design and delivery globally since 2003, so quite many years ago already. And the team members have been using 3D printing since 2006. We purchased our first own 3D printer in 2012, and that was capable of printing material made out of cellulose. Our first 3D printer of our own design was developed for internal use in 2014, and of course in the background we have had the idea of developing a bioprinter, and the first commercial bioprinters made by Brinter came out in 2019. So we are a quite young company still. The company as an independent unit started actually officially operating now in the beginning of 2021, so this year. Here you see the Brinter locations. The headquarters is in the city of Turku, where material and protocol development takes place. Of course, assembly somewhat too. And then another major location for us is the city of Salo, where mass production and contract manufacturing of printers happen. And the team doing development work, marketing and research is also supporting the Brinter efforts from around Finland, from different locations. We'd like to think that actually none of the development, well, maybe some of the development happened through our own ideas, but very few of the ideas are completely created by ourselves, or the projects are carried out by ourselves. But here you have some examples of the collaboration projects that Brinter is involved in. And on the right hand side you can see some of the very capable of organizations. It's not an all-encompassing list here, but you get an idea of the organizations that we collaborate with. My colleague Antti is talking today more about the actual applications of Brinter and what kind of uses it can be used for. Many of them are to do with cancer research and the related drug development, or like the picture at the bottom here, chondral repair development research projects. And the one last application area, there are more, but the one that I included here is industrial uses, and you'll see one example in the following slide. One of the collaboration projects that we are in is a 13 organizations encompassing research projects that aims to develop materials to replace the fossil fuels-based electrical insulation materials. Now there are also other industries like the logistics and automotive industries that have joined the project, so there are many uses for these types of products. Whether this is pure bioprinting is a good question. We have biomaterials, but there are also other materials that we can combine with them. So this in the traditional sense may not be pure bioprinting, but just to give you an idea of the different types of avenues that we are pursuing that are of interest to us and the markets in the future. Antti talked about this too, that the evolving needs that are upcoming and are actually already here. One of them is printing bioelectronics. There are many uses for these types of products. One of them could be, for example, enhancing people with serious illnesses, helping them with, for example, in the case of epilepsy, help in signaling so that people can operate and function better and their quality of lives improve. And there are many other uses, but just to mention one. When we look at Brinter as a device, the one that you can see here in the middle, that's the Brinter basic platform that you can see in the upcoming video here and during this presentation. So that basic platform can carry up to 4 different print heads at once and print up to 6 materials, or if you really push the platform, even 12 materials, depending on the print heads that are on board. More about this on the upcoming video. One thing that we are proud of is the printer's own quite intuitive, in other words, easy to use user interface. It operates via a web browser, and you can use it without any software downloads. So it's quite easy and quick to learn to operate, but also very, very quick capable. And we come out with frequent updates throughout the year. And let's go into the printer demonstration video. This video is about 2.5 minutes. It's not a comprehensive video of what the device can do and in what kinds of environments and what kinds of materials, but it will give you an idea.
Printer 3D bioprinting platform enables bioprinting with up to 4 printheads based on different dispensing techniques and suitable for materials with viscosities ranging from low to high. Printheads are inserted into the sockets on the protective door. Printer software will then automatically identify which printheads have been mounted. First, the printheads are configured by choosing the correct printing parameters. The STL files of the printable constructs are imported into the slicer tab, and the CAD models are sliced to create G-code to be sent to printer for printing. The chosen printhead is attached into the tool changer interface. Next, the calibration of the printheads is performed either by manually or automatically with a light gate. After the calibration, the printing is started, and the printer layers can be cross-linked with UV light using photocuring LEDs. printer has an automatic printhead change tool, enable printing of different materials into the same construct. It also has a camera for online process quality control and for post-printing analysis purposes. In the main control tab, the status and the environmental parameters of the printer can be explored and the actual printing process can be adjusted. Printer, printing live, one layer at a time.
So that was a brief video of how printer operates, and we'd be more than happy to explain more about your challenges. One of the benefits of printer is that it's a good platform, so you can develop and expand on it. The life cycle or the lifespan of the actual machine is quite long because you can bring in more future modules that are constantly being developed, both for research purposes and also production purposes. So this is my last slide. We would be more than happy to continue talking about your possible ideas and uses for our bioprinter and research collaboration too. You can see the contact information here on the left-hand side of the slide. So please do not hesitate to contact us and challenge us with your questions. Thank you. Bye-bye.
Thank you very much, Pasi, for this very interesting presentation that concluded our scheduled part in that sense. But now we have about some quarter of an hour, 15 minutes to have some free discussion, Q&A and stuff. So I suggest you raise your hand if you have some comments, and then I'll try to give the word to you, and let's hope somebody can answer the questions then as well. I think most people are still online here, so please, any questions, comments you may have, now is the time for that.
So my question is actually maybe to Susanna Miettinen. I was wondering if you are still here. What is your idea? How long would it take to actually pull this kind of regenerative medicine application through? So let's say, how long does it take? How long did it take for the knees to be 3D printed and part of the solution? Or anyone else, if there's someone who wants to take a, yeah.
Johanna, I'm still here.
Great.
Quite tricky question, actually.
If you bring the microphone down.
We have been calculating the same thing. How long would it take? And of course, it depends on the application and how much groundwork has been done, how much in vivo work has been done. What is the stage of the material? Is it in GMP level? As you mentioned in your presentation, it was a good point that really it is important to start using that kind of materials that could be brought into clinics. But in clinical translation, it is 5 years minimum, 10 years, 15 years. So we are talking about really long period of time. But really it depends on the application, how complicated it is, whether it contains cells or just materials, whether it is a drug or just medical device.
Sure.
Everything.
Yeah. We know
the
regulatory takes time, and it's sure that the clinical trials and all that takes a lot of time. But I'm just thinking that how long did it take, for the 3D printed ceramics to be part of the, because I think it's not only the question of
of course, if we talk about one patient at a time, you could already use 3D printed ceramics, for example, for a patient. But if you want to have a real clinical trial, then it would take longer period of time.
Sure.
But compassionate use, we are able to do that already.
Yeah, I was just thinking that I think the biggest obstacle I see in the application is that now it's usually applied in one hospital, one setting, one doctor, maybe few, and there is no standardization that would allow it would be at least approved nationwide, because that is what is needed, that some company would actually take that extra step. Otherwise, it will always stay as a nice pilot.
Hospital exemption. Yeah, under that. The thing is that when doctor starts to consider 3D printing, it is this kind of complicated cases where the doctors need very tailored solutions. So that might be one of the, I'm not sure whether it's an obstacle, but one of the issues over here when we are trying to translate our results.
Great. Looking forward to. And maybe I can have a follow-up. So how many are, or actually, do you have maybe, Susanna, still a link where people can connect to the Bioprinting Finland?
Unfortunately, we don't have a link yet. Okay. We are at the beginning, but please stay tuned. We will announce more news about the network, hopefully very soon.
Great.
University bureaucracy has taken a little bit more time than what I expected.
I think that's always an issue with the bigger company.
I should know.
And Andreas, have you sent the link to how to register for the Tissue Cure Alliance if there are any people who are interested in this?
Yeah, actually, the link is on the homepage and on the event page as well. So if you just scroll down there, you'll find it there. I think that's there. But I can put it here in the chat as well, so that everyone can go there. And if you're interested to join Tissue Cure Alliance, it's a fantastic network also. And as you see, we arrange this kind of events, and as soon as we get rid of this corona in 5 to 10 years from now, or whatever it takes, talking about taking long time, then we can also have live events in real life, so to say. But yeah, I'll put it here on the chat. But how is it? Any other questions to our presenters here or so, or comments? There. People are shy to speak out, but there are lots of comments in the chat. So I think many people have enjoyed this event a lot, and it has been really exciting to see what is going on, and really high quality speakers we've had. So if I can brag on Tissue Cure Alliance, we made a great event, and it's all thanks to you that have been part of it, both speakers and participants. But yeah, Antti, please.
Yes, I would like to thank all the speakers and all the presentations. This has been a pleasure day for me. But I would like to point out that the fact that the more that we raise information on the 3D printed biological field, the more it helps us to develop the science and develop our most important things, the future projects, etc. So I would like to urge everyone, so let's kind of put aside the competition and let's raise the general kind of agenda about the 3D printing, because this is something, 3D printing is quite novel stuff. And if I ask my colleagues who are like, most of my friends are doctors, so if I ask them about, okay, 3D printing, so what do they know about it? So the understanding of the possibilities of the 3D printing is at the moment quite low. This is something that you don't teach in high schools in Finland, etc. So we need to raise the possibilities of this field of science. Thank you.
Yeah, I think that's a very important point. When you are an expert on a certain field, you kind of think that everybody knows as much as you, but the general public is happily unaware of what's going on here and what kind of interesting opportunities there are here. So absolutely, and we are part of that. I think, Johanna, you raised your hand first.
Just a quick one. I'm actually planning an article on 3D bioprinting, and I'm planning to have it in Finnish, so that it is actually raising the awareness in Finland, and for sure I will be contacting people to contribute at that point. So stay tuned.
Yeah, and then Prakash, you had some comment.
Hi, yeah, you can call me just DK, and yeah.
Thank you. Okay.
Yeah, so yeah, I agree upon Antti as well, and we need to make some stuff to make aware about this 3D printing, and it is a very huge topic. And I also think we must also have this new talks on microfluidics and also this organ on chip applications. I think it is also related to this tissue engineering applications, and I think that will be the future as well. So it would be better if you have, I mean, if we can have a meeting or assembly about or a chat, coffee chat on organ on chip or tissue on chip, people around Finland.
Thank you to all speakers, all participants, and we'll see you next time on another exciting event arranged by Tissue Cure Alliance Finland. Thanks all and have a great evening. Bye bye.